In Isleworth, a nervous TJ has come to Scott after discovering a deformity in her 12-week-old kitten's chest.
You're tired now, aren't you?
The local family were getting rid of kittens, and I just saw his face and just lost it. He was just something special. I was just in love with him straight away.
Hi, TJ.
Hey, how's it going?
I'm good. Oh my goodness, this is the chap.
This is Foxy.
Oh my gosh. What a beautiful boy you are. I can see where he got the name.
Yeah, the massive ears.
I can see why you're already in love. He's only been 3 weeks.
Yeah.
Wow.
He's just bags of personality. He will climb up you, curl himself in a ball under my chin, and just purr like a Harley Davidson. Foxy, up, up.
When TJ first picked up the tiny kitten, her heart sank.
I could feel straight away that his chest curved inward, and it was very odd. Foxy.
She immediately set up a consultation with Scott.
All right, let's take this little chap in the concert room, shall we?
Oh, well then, yeah.
TJ and I both work together on a TV show here in the UK, and with our love of animals, we've become friends. The main concern you've got is underneath this jacket, isn't it?
Yes.
Right, let's see.
Yeah, take a feel of that chest.
Whoa.
Yeah.
I mean, that's insane, isn't it?
Quite disconcerting.
Look at that. I can get up to my finger, like that.
First knuckle, yeah.
Oh my gosh.
Excuse me, coming through.
This is little Hori.
Hori?
Hori's mum has just brought him in. She's pulled a paralysis tick off. Oh, wow. And just to complicate things, he's also diabetic as well.
On the Gold Coast, blind elderly Cavoodle Horatio has just been rushed into Alex after a potentially fatal bite from a deadly paralysis tick.
Okay. She has said that he's a bit wobbly in his back legs.
Okay.
Owner Bryony was devastated to discover her precious boy struggling to stand.
He tried to get up and his back legs splayed, and giving him a bit of a pat and just noticed a bit of a lump on his stomach and found a paralysis tick. Hopefully I found it fairly quickly, but once you take them off it can actually get worse even though you found it and they seem okay.
Poor boy.
Good boy.
He's just shaking.
Good boy.
Hey, you're shaking, Mr. Hori.
It's okay.
We're right in the middle of tick season here on the Gold Coast. Horatio is presenting today with classic symptoms of difficulty breathing and he's wobbly on his legs. Those are the hallmarks of tick paralysis.
It's quite a sizable tick as well. When they first attach, they're really tiny, like barely able to see them. This one's semi-engorged, so most likely it's been on Hori for a couple of days. And it's really lucky that they found it, because if that had stayed on much longer, it would really have made him very sick. And we know that he's already got signs of tick paralysis. He's unsteady in his back legs.
Okay. Although Bryony's already pulled one tick off Horatio, we're going to give him a really good search over in case there's any more. If there's another paralysis tick there and we don't find it, he could die despite treatment.
I just thought I felt another one there, but
So
it's...
did I.
Yeah.
One here's a bit of a mole, I think.
Oh yeah, he's covered in lumps and bumps. That's going to be very confusing. We're going to keep thinking we're finding ticks, but they're actually just all your lumps and bumps. I can see he's got cataracts there. That's probably as a result of his diabetes. The fact that he's got diabetes, it doesn't change the way we would treat his tick paralysis, but it's just another health condition that his body is dealing with, and so it's likely to make him just more susceptible to complications that can happen with tick paralysis, things like pneumonia, for example. Patrice, if you can get him settled in a bed, let him settle down, and then I'll go and get a bit more of an idea of what he's been doing at home.
Okay, come on, mate.
Alex is desperately hoping they're in time to save the elderly dog, but his symptoms are already worsening.
Alex is quite upper respiratory. It's like almost like his larynx is starting to get some paralysis up there.
Yeah, I can just hear that.
Up in here, yeah.
Time's really ticking here, so we've got to get started.
Good boy.
Good boy.
Okay.
That's insane, isn't it?
Quite disconcerting.
Look at that. I can get up to my finger like that.
Their snorkel, yeah.
In the UK, Scott has just discovered an unusual cavity in the chest of little 12-week-old kitten Fox.
Oh my gosh. Fox is already suffering as a result of his congenital abnormality. He struggles to breathe sometimes, he's quite breathless. He has something called pectus excavatum. In humans, it's like an inward-pointing sternum or breastbone. So I think it used to be called pigeon chest.
Yeah.
So rather than your sternum, your breastplate slightly going out, his is going way in. So that reduces the size of his chest cavity. And as they grow, their heart and their lungs don't have anywhere to mature into. Unfortunately, with this condition, the kitten won't live naturally longer than 12 months. It's always tough when you tell an owner that their beloved animal might not survive, and unfortunately with this condition, Fox just won't be able to develop into a normal adult cat. The surgery that we need to do is basically to encourage that yet to be fully stiff breastplate, the sternum, and we have to pull it out. The risks of that though are heavy. I have to put a number of needles into his chest.
Okay.
And inside the chest cavity, will not shock you, is full of really, really important things.
Yeah.
If we nick any of those, he won't make it through the surgery. And even if I don't, the opening of the chest cavity to a normal size can also lead to them stop breathing.
I'm quite anxious now, but I don't know, it's best to have honesty, I think, because, you know, he could lose his life, but if he doesn't have the surgery, he could also lose his life, so.
It's a lot to take on, and I appreciate how much you love him already and how hard that must be.
TJ must now make a tough decision.
Alex, he is quite upper respiratory. It's like almost like his larynx is starting to get some paralysis up there.
Yeah, I can just hear
just
that.
up in here, yeah.
On the Gold Coast, 14-year-old Cavoodle Horatio is fighting for life after being bitten by a deadly paralysis tick.
Time's really ticking here, so we've got to get started.
But the blind elderly dog is becoming increasingly distressed.
So we just got to be really,
A little bit more careful.
yeah, a bit careful, let him know we're coming.
Good boy.
I don't think you can hear very much either, so.
Aw,
Poor old
what a
chappie.
good day, mate. Good boy. I know, it's a bit of a funny feeling.
We really just need to get this IV in. Once the tick anti-serum infusion starts to get into his system, it starts to bind up the tick toxin and stop him becoming more paralysed. Yeah, I can just hear his breathing there a bit.
Good boy. It'd be much better if you lied down.
As Horatio's feeling the paralysis, he's starting to panic.
Calm down.
So we're going to give him some sedation, which will help to take the edge off his anxiety. This is the really tricky thing with tick paralysis. We want to get this tick anti-serum on board, but we're trying to put the catheter in and he's getting more and more stressed. And if we stress him out too much, we could kill him just by doing these things.
I know you do.
Hey, just calm down.
Stand up. You don't like it.
Yeah.
Hey, no. You can't jump off. That's not clever.
As soon as you start to restrain him, he just freaks out.
So nice to get out of the city.
In rural Victoria, Danny is answering a call from Nikki at Beagle Freedom Australia about a special little rescue boy called Manesh.
Okay, pop, come on, let's go. I've heard about what an amazing job Beagle Freedom Australia are doing, and so I really wanted to help them out, and I did hear they've got a dog that's having some eye problems, so I thought I'd come and check out how he's going today. Hello, Nikki, how are you?
Hi, good, thanks. How are
Good to
you?
meet you.
You too. Beagle Freedom Australia is a rescue group. We take them in, we find foster homes and we find adoptive homes for them.
Who have we got here today?
Today we've got Timmy,
Hi, Timmy.
We've got Freckle and Pup Pup.
Hello, Freckle. Oh, gorgeous.
For most of these rescue beagles, it's the first time they've experienced regular love and attention. Donations help them transition from foster care to loving new homes.
We have been very lucky to get funding from Save a Life. They've helped us build a yard to rehabilitate them as far as a foster care home or an adoptive home.
Is Manesh hiding? Is he around?
Manesh is inside.
Shall we go see him?
Let's go see him.
Wonderful. Come on to me, mate.
Come on.
I've come here to see Manesh because I've been told he's had some long-term issues with his left eye. He's had long-term dry eye and they're really struggling to get it under control. Oh my goodness, this is like doggy heaven.
Thank you.
All these comfy beds.
So this is Manesh.
Oh, hello, Manesh. Hello, darling. We're a bit shy, aren't we, hey? How did Manesh come to be with Beagle Freedom Australia?
He was released to us from a medical research facility.
How's he been since then?
He's good, he's come a long way. He used to be really shy and withdrawn, but his confidence has really grown.
Oh, wonderful.
But he has got this issue with his eye.
Not having much success with
No,
it,
it's
are
not
you?
responding to anything.
Oh, should we have a little look and see how it's tracking
That'd be
today?
great, thank you.
Hiya, mate. Hi, Manesh. You're a sweet boy. Oh, mate. Yeah, so there's a lot of purulent discharge there, which is not good. And that surface of the eyes is very regular. I think I can see there's an ulcer there, even without using any stain at the moment. Now, what treatment are you currently using for that eye?
So he currently gets medicated drops 3 times a day.
Yep.
A different type of medicated drops into his food twice a day.
Yeah.
And he's getting lubrication every couple of hours.
Yeah, that's a lot. The fact that that's still there despite throwing everything at it medically.
Yeah.
I've seen specialists who've done everything. I think that's been exhausted and it's just not going to work. And I think the only real option, the practical option going forward is to remove that eye, unfortunately.
The opening of the chest cavity to a normal size can also lead to them stop breathing. You really, unfortunately, don't have much of a choice.
In Isleworth, TJ must decide whether to proceed with high-risk surgery to correct her 12-week-old kitten's life-threatening birth defect.
If left and untreated, sadly, it will lead to his premature death.
I really love him so much, and he's so full of life. You know, I really want him to have a good life.
Courageous TJ decides to go ahead with the perilous procedure to try to mend Fox's deformed chest bone.
And even greater pressure for me is that actually today is my 25th anniversary of being a vet.
Oh, congratulations. Well, I'm hopefully that's good luck for him.
I really, really hope it is. It's been a great career. It's been what I dreamed of doing ever since I was 7. And today, being that I'm performing a surgery that I've never performed before on a friend of mine's kitten, there's some pressure there, but I think the experience that I've developed over those 25 years is going to count for a lot. All right, say goodbye to Mummy.
Bye, baby. Be good.
I'll look after him, I promise. I'll get you back to Mummy very, very soon.
Saying goodbye is always difficult, but not knowing whether I'll see him alive again is even worse.
Before operating, Scott x-rays Fox's chest to see the extent of the malformation in the tiny kitten's breastbone.
X-ray. Quite an astonishing X-ray. So you can see here, this is his breastbone, his sternum, and that should just go straight down like that, and you can see it's going, whoa, like that. It's just so abnormal. It's curving right inwards, almost like a, witch's deformed finger or something.
Because of the high risks involved in the surgery, Scott has chosen experienced nurses Gina and Jason to assist.
I can't downplay the concerns regarding this procedure because basically what I have to do is put a needle inside his chest cavity multiple times. I could puncture the heart, I can puncture the lungs, so we can either get internal bleeding and he'll die on the table, we'll get a punctured lung and he'll die on the table. And then also when we open up the chest, because it's all of a sudden got this huge amount more volume than it did before, we probably will see some issues with the anaesthetics. You come back to us, okay?
Yep.
Doctor's orders. Okay, let's do this.
Leave it. Leave it.
It's definitely a paralysis tick. I'm going to take a quick x-ray of your tummy and have a look what's going on in there, buddy.
In Bondi, it's a busy day at Kate's Veterinary Hospital.
You're a good boy.
She's brought in her beloved Benny.
Benny had his teeth cleaned yesterday. So clean.
And vet Edwina is about to arrive with her own elderly dog, 14-year-old pug, Waffle.
Come on. Got Waffle when he was 8 weeks old, so I've had him in my life for 14 years. He means the world to me.
You good boy?
We've been through a lot together and he's always been there by my side.
Such a good boy. Benny, my dog, and Waffle. They're always here. Here you go, Waffle. They really are just a part of the furniture. Good job. Waffle loves to chase Benny, especially when he thinks Benny's got snacks. They both absolutely love food. And these two have the loveliest little bromance. They absolutely adore each other. Good morning. How are you?
Good, how are you?
But lately, Waffle's having increasing difficulty walking.
Do you have to carry him?
Yeah, I kind of have to always carry him across the park now.
He can't make it across the park anymore.
Can't make it across. I mean, he used to be able to make it across, but now his little back legs just give up. Waffle has an issue with his legs where he's got a defect in the shape of his spine. He was born like that, but over the years it's compressed on his spine and caused some damage to his spinal cord. And so his back legs, they're just weak.
I don't think he has any feeling in these back legs.
No,
Look at them.
hardly any.
Waffle doesn't feel his back legs, so he's not like he's in any pain. But what's happening now is that Waffle can't really even walk properly. So that's starting to become a mobility problem for him. I mean, to be fair, I think Benny's probably also in his category. Like, I don't think he can make it over the park either.
Oh, yeah, right.
Just old, man.
Yeah, old boys.
It's really hard to watch your dog deteriorate. And I can see in Edwina, there's this Waffle is doing really well, and then all of a sudden he's not doing well. And I know she's thinking that maybe Waffle, it's almost time to say goodbye to him.
Edwina's desperately hoping there's another solution for her precious boy.
Okay, let's do this.
In the UK, Scott is operating to try to correct a severe birth defect in 12-week-old kitten Fox's chest.
So we've got one in now. I am blindly placing a needle into the chest cavity. At any moment, I could perforate his heart. He could bleed out within seconds. So I'll be starting up this end, and then slowly as we go, we'll be lifting and tying the sutures. And by doing so, it'll allow me to lift up the sternum. So kind of if you have a log and you put rope underneath the log all the way along, well, then you can lift the log up.
Once the sutures are in place, Scott will attach them to a custom-made breastplate that will hopefully stimulate Fox's chest bone to grow outwards instead of in. But first he has to insert delicate stitches without inflicting a fatal injury on his tiny patient.
They'll start getting a bit easier now, won't they?
No, they're actually getting harder.
Oh.
I know you do. You just can't stand up. You don't like it. Hey, no. You can't jump off.
On the Gold Coast, blind elderly dog Horatio is becoming increasingly agitated, making it difficult for Alex to start him on urgently needed tick anti-serum.
So we've got IV access now, which is good, and he's settled down with that sedation. But I'm really worried because the tick paralysis can often make them feel quite nauseous. And I really don't want him to vomit because there's a risk that he'll aspirate because he's losing control of his airway. So I'm going to give him an anti-nausea medication via the IV, just to be sure. Because we know for certain that Horatio is suffering from tick paralysis, the next priority is to administer tick anti-serum intravenously. Okay, let's go. Hey, mate, pop you in there. Hey. Sit down for me. Sit down. Good boy, that's it. Tick anti-serum will help to bind up the tick toxin that's circulating around his blood system. So we're just getting him hooked up to the tick anti-serum now. But before we even think about starting this, we want to make sure we've got all the monitoring on him because he can have a reaction to this, just like someone having a blood transfusion, anything like that. We're putting something foreign into his body. So he needs it to save his life, but we also have to make sure that we're ready for any reaction that he might have. We can see there that he's oxygenating really well, 99%, that's brilliant. His heart rate's about 140, so that's all good. Okay, we're ready to get started. The benefits of tick anti-serum outweigh the risks. If Horatio doesn't have tick anti-serum, he will die. Hey, be a good boy, all right? You need this, okay? You'll need this. He's half deaf, he's completely blind. Hey, what a confusing time.
All right.
They'll start getting a bit easier now, won't they?
They're actually getting harder.
Oh.
Right, okay, next one.
In Isleworth, Scott is cautiously inserting stitches into Fox's chest, dangerously close to the little kitten's heart and lungs.
Putting sutures in a chest cavity on a 12-week-old kitten obviously is risky. The margin of error is so small. So yeah, that's good. Now we're getting somewhere. Look at that, that looks great. I know that he's past the point of danger, and I know I can correct the deficit that nature dealt him. We're gonna put some padding in place. I'm gonna trim it a little bit.
With the most perilous part of the surgery over, Scott now attaches a temporary breastplate to Fox's chest.
Right, so that's our suit of armour on, and hopefully a nice straight sternum underneath. The plan is that it will remain there for up to 3 weeks, and what that will do is encourage the sternum to lay out, and it'll start to ossify, so it'll start to harden up. And then when we remove the plate, the breast should stay in position, and that'll then mean that this little guy will live a full and natural life. X-ray. Great. Yeah, so you can see that. Before it's sort of almost like an S-bend of a toilet, and now it's much straighter. So the chest has got all this extra space, so now his lungs have got to use.
While little Fox recovers from his life and death surgery, his owner TJ arrives, desperate to be reunited with the much-loved kitten she feared she might never see again.
There he is. There he is. Oh, look at your little outfit. Hey, baby.
Yeah, so he's still very sleepy. Underneath here, there's a breastplate. He's going to feel like he's wearing a straitjacket, so he's not going to think that's brilliant, but very quickly he will get used to it. I'm hoping over the days and weeks, what we'll see is he'll start breathing into this new chest cavity.
Oh, I don't know what to say. I don't know what to say.
It's wonderful you put the faith in me, and after 25 years, I still got it.
Yeah.
that's really good. So I'm so glad for you, and he is just a dream. I couldn't think of anything better than on my 25th anniversary as a vet to be able to perform a surgery like that, to be able to give Fox the chance at a full and natural life that he wouldn't have had. Very satisfying, and I'm, very proud, 25 years.
I can see there's an ulcer there, even without using any stain.
In rural Victoria, Danny is shocked at the severity of Manesh's painful eye condition. Nikki is hoping something can be done so the gentle young dog can find a new home.
The practical option going forward is to remove that eye, unfortunately. It's a big decision to make, it's quite confronting, but I think for him, I think he's going to be so much happier.
Yeah, absolutely. He hates it. He absolutely hates it. Yeah.
I bet. Come on, puppy, come on.
Surgery on Manesh's badly ulcerated eye will finally mean an end to his chronic pain.
Come on, Papa. The goal at the end of the day is to get Manesh into his forever home, and so hopefully by treating this eye once and for all, removing it from his life so he can heal, he can be pain-free, he can build bonds, he can move on, find a beautiful family.
Come on,
Hey,
Manesh.
Papa. Hey, good boy. You'll be sleeping now, hey? An eye enucleation is essentially just the surgical removal of the eye, the globe, and the procedure that we do removes all the surrounding structures within the socket as well. You just breathe a bit of oxygen in before we induce you, my sweet. Hey? The main risks associated with an eye enucleation is hemorrhage or bleeding, but the more frightening concern is if there's too much traction placed on the eye that you are removing, and that then damages the nerve supplying the other eye, and that can affect the vision of that eye. So that's a bigger concern for me, so just have to be very careful. So initially, we just want to stitch the eyelids together, and the main reason behind that is to keep any infection and discharge tucked behind those eyelids whilst we do the rest of the surgery.
Brave Manesh has endured chronic eye pain for months, with intensive treatment having little effect. Danny's aim is to make him pain-free and on the way to a happier life in a loving new home.
Okay, it's coming out. So we're at the stage of removing the globe, and unfortunately we are having a lot of bleeding today. In eye enucleations, there are a lot of vessels there, and it's a bit inevitable that there'll be some level of bleeding. So the main thing now is focusing on stopping that bleeding, getting that under control before we close up the surgical site.
Good boy. Oh, buddy.
With the surgery complete, a very sleepy Manesh will be closely monitored over the next few hours.
Manesh is recovering really well from his anaesthetic. He seems very comfortable, content, so everything's going really well for him.
Good boy.
Come on. Where's a good boy? Oh, we're going to clip all that hair off, eh?
On the Gold Coast, Horatio has now had a full dose of anti-serum to start reversing the paralysing effects from a deadly tick. But he's still not out of danger.
A bit of sedation's still doing good work.
Ready?
Horatio has such a thick coat that I can't be sure there's not another tick hiding there. He's got so many lumps and bumps and places for ticks to hide. So now we're going to clip all of his hair off.
You're going to look like a very different puppy dog.
It's the only way I can be 100% sure that he doesn't have another tick.
You're going to be like a shorn sheep, just in time for summer, eh? Now the tick she did pull off, that was on the side of his belly, so we should see a tick crater down this side somewhere. This side? Yeah, I'm pretty sure it was this side. Yep, that's it there. So that's where the tick was attached, and that's pretty typical for what a tick crater looks like. So wherever she's cutting the hair off, I'm going through with my fingers, looking to see if there's any evidence of a tick underneath. So far, so good. So far, no more tick. All right. Yeah.
Hey, dear.
Hey.
Heaps better. How handsome are you?
So all the hair's off and no more ticks. So it looks like that one tick did all of that damage. What that means is that we've really done what we needed to do that was really urgent for Horatio. From here, it's really all about nursing him until the paralysis wears off. There we go. That's half of Horatio in the bin. Boy. And my mum's going to be very happy when she hears that there's no more ticks. Good boy.
You have to carry him.
Yeah.
I don't think he has any feeling in these back legs.
No.
In Bondi, Kate is trying to work out why elderly pug Waffle is losing mobility in his back legs.
Maybe we should take some x-rays of him.
Yeah, good idea. That'd be good.
Are we going to take some x-rays of your back, Waffy?
Yes.
I mean, we can do these conscious. He's good, huh?
Yeah. He's a good boy. Aren't you? You're not going anywhere fast.
Come on, let's go do it.
Do it. It is hard seeing your dog decline. I feel bad for him because I think his quality of life's just not as good as it used to be. I realise he's only got a limited amount of time left, so I just want to spend as much time with him as possible.
It's okay, buddy. Don't worry.
So what we're trying to find with the x-ray is if there has been any changes to Waffle's spine since I last took any x-ray images, which was about a year or two ago. I just want to make sure that there's nothing else going on.
I'll press the button when you're ready.
Okay.
X-ray! What?
I know, it's bad. Yeah.
I mean, we knew he was bad, but this is that's like next level.
Yeah, it's quite amazing that he's still
alive. The shape of this spine is actually compressing the spinal cord. And what that means is that Waffle can't feel his back legs.
I'd love him just to live forever, but I do worry about him. I think his quality of life, just being able to get around, and he was always such an active dog when he was younger.
So for a variety of reasons, Waffle is not a surgical candidate. It's not something that we can do surgery on and all of a sudden he's going to have a fixed back. So we're going to have to find some creative ways to get Waffle to live his best life. Look, his liver's good, his heart's good.
Yep.
I still see him as super happy. You know, every time he's here, he's such a ray of sunshine.
Yeah. It's nice knowing he's not in pain, but I'd love to give him a bit more mobility.
Hi, TJ.
Morning. How are you?
I'm good. Hello, my gorgeous little fluff ball. How are you?
It's 3 weeks since little kitten Fox's life-saving surgery, and TJ has brought him back to Scott. It's time to have his breastplate removed and to see if his chest is now developing normally.
How's that? Does that feel better? Right. Well, everything's sounding really good. The deficit's definitely reduced.
Yeah.
Good boy. He's got a lot bigger chest cavity than he did before.
Now we've removed the breastplate, I'm really happy with the way Fox is looking. He is breathing far bigger, deeper breaths, and I'm incredibly hopeful that this little cat and TJ can live a long and loving life together. All right, buddy. See you later. Breathe well. See you later, TJ.
Take care.
Bye.
Bye.
It's definitely been a massive relief to know that you give them the best chance to grow up to be a big fluffy ginger cat rather than just a little one.
Hello. Were you having a nice snooze?
On the Gold Coast, the danger is finally over for 14-year-old tick bite victim Horatio, and he's now ready to be reunited with his anxious owner, Bryony.
Well, it's time to go home, my friend.
Horatio has been very stable, and now that his treatment's complete and we've applied some tick prevention, I'm happy for him to go home.
Good boy. Hey, you look like a different dog. Good job. Let's go see your mum.
I know that he'll probably look very different, but it's for the best, and also he was due for a haircut, so. He's here.
I told you he'd look different.
He does.
Yeah, he's still pretty sleepy.
Yeah.
But, you know, I think if he just goes home.
Wow.
I think he looks a bit different.
He does look like this usually when I clip him.
Does he? Okay, so you're quite used to it.
A little bit more on top.
It's such a privilege to reunite Bryony with Horatio. It's been a big day, but it's a happy ending.
See how he goes tonight?
Great.
Hopefully back to himself in a couple of days.
Alrighty.
Okay.
Thanks,
Awesome.
Alex.
That's okay.
In Melbourne, it's been 3 hours since Beagle Manesh had eye surgery. And now a very anxious Nikki has arrived.
Good boy. Here we are. Hello. Hello, how you going? Good, how are you? He's been such a brave boy, haven't you, darling? And he's woken up so nicely. He's really comfortable. He's had a bit of a bite to eat, but I thought I might just give him an extra treat because he's been so good. It's been such a big day. Hey, Papa. Hey, buddy. Now, I'm just going to pass you this because they're all of his medications with pain relief antibiotics to start up from tomorrow morning, okay? Yep. Now, I'm going to give you another little treat, mate, because you've been such a good boy, hey? Such a brave boy. Oh, yeah, there's the tail. Good boy. So other than his medications, we want to keep him relatively still, particularly tonight, just keeping him quiet to help reduce that swelling that's going on there. And using some ice, you know, for about 10 minutes at a time, every 20 or so minutes would be really good. And just keep an eye on it. Obviously, if you see any discharge or any concerns, give us a call. Okay. No more eye drops, darling. That's good, hey? Awesome. That'd be good for you too. Yeah. You can take these treaties home with you. Oh, lucky boy. There you go. Yummo. All right, darling, we'll see you in a couple of days. Seeing Manesh and Nikki off today is a really nice moment because I feel like it's that first step into the rest of his life. He can now be pain-free. Yes, he's got to recover from this surgery, but he's going to be one happy dog now and he can go find his forever home. So it's wonderful. All right, will you take care, Nikki?
Oh, thank you so
Got
much.
any concerns?
Thank
Absolute
you.
pleasure. We can't wait to see him on the other side of his healing.
Yeah, me too.
Yeah.
What?
I know, it's bad. Look at this.
The shape of this spine is actually compressing the spinal cord.
In Bondi, Kate is shocked at the deterioration in 14-year-old pug Waffle's spine.
You know what? A couple of months ago, there was a little pug that died and the owner had wheels and he donated them to the clinic in amongst this place somewhere. I'm sure there's some wheels and it was for particularly a pug. So I wonder if they'd fit him.
Let's give it a go. Funnily enough, I guess it doesn't seem a strange idea to put him in wheels for me because, you know, being a vet, it's something we do consider for our other clients.
Are you going to get some wheels?
Yes.
Yes?
You excited about your
I know, I have to go find them. I have this really bad feeling that they're actually up in that attic with all the spiders. Oh my goodness. See, there's going to be like snakes and spiders and everything that's going to eat me in this thing. Okay, I can see them. I found them. I found them.
Oh, wow.
Yeah, they're upstairs.
Oh my God. They look perfect.
Yeah. I mean, they're perfect pug size. They're a bit dusty.
Back legs.
1 and 2.
There.
Yep. Whoa. Okay. Okay, whoa. Okay, hold on.
We know what we're doing, guys.
Take 2.
All right. Take 2.
Okay, wait, let's just start this again.
So far, the dream of Waffle whizzing around on wheels isn't looking too promising.
Okay, take 3. Okay, 1 leg and 2 legs. Good job, Waffy.
Down.
Good job.
That's it.
Okay, hold on. Okay, yep. Ready, Waffy? Do it! Oh my God, he loves it. So good. Can even go backwards by yourself. Waffle absolutely loves his new wheels. He thinks they're the best thing since sliced bread. Look at you! Yay!
Oh my God, it's amazing. He's taken to it like a duck to water.
Well, you're a good boy.
This is going to change Waffle's life.
No. Can we do a circle? My God, it's like a pro.
It's a pro.
I might take him to the park.
It's like going to be the first time he gets to run at the park in like years.
I know. It's so nice to be able to give him the opportunity to make him feel like a puppy again. I'm a happy, happy dog mum now. You ready? Come on. Let's go.
Good boy.
It's amazing to see him running around like this again. Just looks so happy, and I think it's just so nice to be able to give him a bit more mobility and freedom.
You got it.
He's always been such an active dog, and it's just nice to see him back to his old self.
Woohoo! Good boy.
I think that the best part of being a vet is being able to just change an animal's life, even in just a really small way. Sometimes you have to be creative, and the main purpose of being a vet is to improve that animal's life as best as you possibly can. And I think that we achieved that today.
Good boy.
A week later, 14-year-old Horatio has bounced back after his near-fatal encounter with a deadly paralysis tick and has been enjoying plenty of extra TLC from devoted owner Bryony. At Scott's Isleworth practice in the UK, Sunaz is bringing in very, very pregnant mum-to-be, Cardi.
Hi, Sunaz.
Morning.
Hi, good morning. Oh, my word.
Wow.
Oh, wow. Look at the size of you, missus. She just looks like a hippo, don't you?
Look at that tummy. Oh, she's absolutely piled full of babies, isn't she?
Do you think she's going to make a good mum then?
I think she will do, yeah.
Yeah.
She's really good with the kids.
Scott is doing important last-minute checks to make sure everything is okay for Cardi's caesarean birth.
In this picture, there's one there, and then there's one there, and then there's one there.
18-month-old French Bulldog Cardi is a first-time mother.
You're such a good girl. Oh, there's another heartbeat there.
Cardi, she looks absolutely gigantic, and she is stuffed full of puppies. And the unfortunate thing when it comes to French Bulldogs, they struggle to give birth naturally. To be able to pass all these puppies, and there is so many, there's got to be 8, 9, 10.
How are you feeling about the risks involved with the actual cesarean itself?
I'm feeling nervous now for her. I'm just hoping that everything goes well for her and the puppies.
Her puppy is actually looking very healthy. Their hearts are beating really nicely.
The ultrasound and blood tests have given Cardi the all clear for the big surgery.
Thank you.
Bye. Hi there. Hi. Oh, look, it's a pregnant ladies' conference.
Suddenly, Scott's day is about to get a whole lot busier.
Look at that. 2 expectant mums.
Calm down.
In Bondi, Izzy is arriving at Kate's veterinary hospital with 8-month-old Miko.
What's going on? What's going on? You okay?
Hello.
Hi, how are you? Who's that?
How are you?
Doing well.
The lively young Australian shepherd clearly loves being the centre of attention.
Are you going to come through so I can have a look at you? Oh. Do you like a scratch on the tummy? Yes, I do. Come on, little monkey.
Izzy wants Kate to look at Miko after noticing something worrying in the way the dog walks.
Got Miko when she was 8 weeks old. So, like, the very second that you can get her, I got her. I always wanted a working dog. They're super smart and super loving, and yeah, I just wanted all of those elements in one.
1, 2, 3, go!
Baby.
Well done. So before we start, tell me about what's been going on.
I feel like she just has a little bit of a limp in her back left leg. It comes and goes. She loves to play at the park.
Okay.
At speed, she's fine. After she plays with dogs, especially big ones, she kind of walks away with a little bit of a limp.
Okay.
And then she'll lie down.
Has she been well otherwise? Has she been eating and drinking and doing all the right things? She looks like super healthy.
She's been great. She's been really good.
Yeah.
She's a little mixed because she's 8 months old, but she's great.
When Izzy got Miko, I felt like she was a little ray of sunshine, and I was like really hoping that there was nothing wrong with Miko at any point. I'm gonna feel a good leg first.
Yes, good girl.
Kate's having a good feel around Miko's hips to see if there's any reaction that might indicate pain.
Okay. It's okay, good girl.
Hi there. Hi. Oh, look, it's a pregnant ladies' conference.
In the UK, Scots Day is turning into a puppy marathon.
Look at that.
With not one, but 2 heavily pregnant dogs ready to deliver their pups at any moment.
Bye. All right, bye. See ya. Bye. Right, Shana, let's go.
Shana has just arrived with her 3-year-old English bulldog, Callie, who's also about to give birth at any minute.
Hello, baby. Hello, how are you?
As a vet, I've performed quite a few cesareans, but I've never performed 2 on the same day. And being that both their mums are friends, they just thought, you know what, we'll all have this bit of puppy pandemonium together.
Do you want to see your babies? Yes?
Good girl.
She's such a nice girl, isn't she? Hey?
We have been anxious and nervous. It's both our first experience having a litter of pups.
All right, my angel.
Unlike Cardi, Callie has had a tough time with her pregnancy.
I'd just love for us both to see a heartbeat.
Callie has had quite the checkered pregnancy. During the course of it, she's had an infection, and on ultrasounds, we've seen areas that look like puppies but don't have a heartbeat. So there's a number of things for Callie, for me, and for Shana to be worried about.
It's no one's fault. It's, you know, sometimes, unfortunately, pregnancies end in heartbreak.
Yeah.
And there may be an element of that with you guys.
Yes, good girl. See, it's okay.
So as you can see, it's very difficult
She has a personality.
to see what's painful and what's not painful.
In Bondi, Kate is trying to work out if 8-month-old Miko has any painful areas around her hips. Owner Lizzie has noticed a slight limp in her lively young dog.
It's okay, good girl. That doesn't hurt. So what you can see today is that Miko isn't having none of this. She's squealing and carrying on like a pork chop. And the reality is that it's very difficult to tell in a puppy of her age whether something's pain or whether she's just being a monkey. I know, darling. Shh.
So Kate decides to take Miko outside to see just how serious the limp is.
Sweet. Here we go. Come here, Juke. Let's go.
So what I'm going to do is I'm actually going to take her for a little bit of a run, just to see if I can actually see any lameness in that back end or even in her front legs. Okay, so do you see? Come here. Guys, do you guys see that? To an untrained eye, Miko looks completely normal. I can see she's pretty heavy in the front limbs. And that makes me automatically think, is there something wrong with her back legs?
Well done.
No one knows their dog better than the owner. And the reality is when Izzy says there's something wrong with her dog, I take that seriously. She's only 8 months. And if there is something wrong with her legs, early intervention would be ideal. And I think what we might do is keep her here and take some x-rays.
Okay.
And I think that we get an answer, right?
What is the worst case scenario?
A worst case scenario is that she has some kind of genetic abnormality, something like a hip dysplasia, or she's got some early signs of degenerative joint disease.
Great.
Hip dysplasia is a congenital abnormality which results in an ill-fitting ball and socket in the hip joint.
I guess my worry around the x-rays would be whether there was a potential surgery that was needed to be done, or if there's something that's ongoing that's going to cause Miko trauma.
So let's do VDs first. There is no cure for hip dysplasia. At very best, you can give them new hips, but what it really means is a lifelong condition that causes them pain. It means they can't do regular dog fun things. It's not a great life. X-ray.
My instant reaction is worst case scenario.
This is not what I expected to see at all. I'm going to send these to a specialist just to be doubly sure.
Oh my God, I cannot handle to lose her.
With the x-rays now going to a specialist, it's going to be a nervous 24 hours for Izzy. Today, Mobile Vet Allstars is swapping the city for rural Queensland. And an interesting challenge.
Brad, who's the founder of Animal Farm Rescue, has just given me a call. He's got a patient that he urgently wants me to check out.
Brad runs a cattle property and one of his steers is in trouble.
Hi Brad, how are you? What a beautiful location we're in. This is just stunning. Look at this view.
And welcome to Farm Animal Rescue.
Thank you for having me.
We don't really sort of notice it so much anymore.
It's stunning. The drive here was just beautiful. It's like out of a storybook. I hear you've got an interesting patient for me today.
We do indeed. We've got Boris ready to go. And his problem is that he's got a horn that's about to grow into the side of his cheek.
Oh dear. Okay, let's go check him out.
Sure.
Brad tells me that today we'll be treating his steer. I'm automatically a little bit nervous because I know these are big animals and I'm not used to treating them every single day. And here he is. I'm anxious, but I'm also very interested to see what we'll be doing. I can definitely see that that left horn is quite abnormal. So what's been going on?
Well, we picked up about 4 or 5 months ago that we were a little bit concerned about the direction that the horn was going.
Yeah.
So we've been monitoring, but as you can see, it's now at the point where he could start to get the horn actually growing into the side of his cheek, which of course we don't want.
Right there, isn't it? It's very, very close. And compared to the other side, I suppose the other side is further set.
Yeah.
So, and it's not growing into the face, whereas the other one is actually poking right in.
Exactly right.
Yeah, that's in a dangerous location, buddy. We really do need to do something about that horn straight away.
He's quite a fierce guy. He's quite happy to just come up and just push you.
Ah.
So if he's hungry, he'll just come up and he'll just push you from the front. But the problem is that a gentle push for him, of course, has 600 kilos behind it.
Okay, you're a bit feisty, Boris. Does that mean we've got our work cut out for us today? You're giving me that look. I'm actually quite scared about this one.
Hi! Big day.
Big day.
In Isleworth, Scott is about to perform back-to-back caesarean deliveries for Shana's English Bulldog Callie and her friend Sunaza's French Bulldog Cardi.
Morning.
Good morning. Hi. Oh, hi, girl. Today is going to be a huge day. I am feeling a little bit nervous. It's a lot of lives to manage. It's a lot of people to manage. It's going to be crazy. There's going to be puppies flying in all different directions, and I'm not sure of the outcome. She looks like a very exhausted pregnant mum. She can't breathe.
The heavily pregnant Cardi will be the first to give birth. Scott's concerned she's carrying a huge litter for such a small dog.
The adrenaline's pumping. Everyone feels it. It's a big operation as far as Cardi's concerned, but it's exciting. We just hope it all goes well. The first cut is always the tricky one because you've got babies right underneath. So a millimetre will mean perfect incision or cutting a puppy. Performing caesarean is a big thing. It's putting a dog that's already massively pregnant under anaesthetic. It means that the puppies are also under anaesthetic. Nothing about this is natural. Okay, team, everyone ready? Okay, this one. Okay, go for it.
As the puppies start arriving, Scott's support staff swings into action.
Come on.
Come on, this one's gasping.
It's crucial to get each puppy breathing before it's too late.
2. Okay. As soon as I open Cardi up, I'm like, wow, there is a lot of puppies in here. She is jam full. And I look out the window and I see how many people I've got. I think, have I got enough? Has anyone else got a spare set of hands? We've got 3 out so far. I'm yet to hear any cute puppy noises, so that's never good.
Everyone's breathing.
Okay. Okay, go for it. That's it. That's 4. Okay, I've got another one. Sorry, guys.
Okay.
My team are working on all these puppies. I'm just not hearing them crying. I really want to get stuck in and trying to rescue and save as many of them as I can, but I do need to focus my attention on Cardi, so I'm really torn at the moment.
Come on, just keep rubbing it.
Nina's got one too.
Come on, sweet.
Let's go.
The next day, in Bondi, the specialist report on Miko's hip x-rays is back, and it's time for Kate to deliver the findings.
Hello, Miko. Hi. Hello. Oh, no. Hi, Mama.
You want to come and have a look at these x-rays?
Yeah.
Let's do it.
Okay.
So let's just start with the good news.
Okay.
They're fine.
They're all fine.
Right? They're all fine.
Everything is fine.
Everything is fine. She does not have hip dysplasia.
It's like my whole body just went...
I'm so relieved. I'm trying to look for a fault and I can't see one, and I'm cheering. So as you can see, the ball of this hip is really nice and snug in the pelvis. That's exactly what we're looking for. You actually have a dog with nothing wrong with her.
Nothing wrong with her.
What I do want you to do from here, though, so a few rules. As you can see from these x-rays, she still has a lot of growth plates there. This is the edge of the tibia, and this is actually a growth plate in here. Eventually, that little tibial tuberosity is actually going to form a beautiful joint. And all it would take is a very small amount of pressure on one of these to displace those growth plates.
Wow, yeah, okay.
And then that whole piece of bone basically can fall off. You need to be very careful that you don't injure those bones.
Okay.
And the best way is controlled exercise, so
Yeah.
not letting her go for an hour at the park absolutely nuts.
Yeah.
Doing high impact activity would be sort of equivalent to a child doing weights. Their bones are soft, their growth plates are soft. We need to make sure that we look after them. Bye, you guys.
Bye, thank you.
This is Carson.
Carson,
Carson's a 3-year-old who owners have just reported have eaten a large yogurt container 3 days ago.
On the Gold Coast, a greedy young Labrador has been rushed into Gerardo.
Wow. Come home and found a container on the floor with big chunks missing off it.
Owners Maureen and Robert fear their boy has been up to mischief.
After having a look around the house, we couldn't find much plastic or anything, so we figured that he must have consumed most of the container.
Oh, it's pretty concerning. Labradors are renowned for eating things they shouldn't eat.
Underwear, socks, anything he can get.
Yeah, he's very mischievous.
Anything that's not at least 10 foot off the ground he can get to.
Yeah.
And yeah, he's been doing this for 3 years.
Oh, Carson.
Owner feeds him and then he vomits pieces of container as well as his food, but he's also passing chunks of container as well.
You're bringing up the container on both ends. Only a Labrador would eat the whole container too, mate.
Sharp pieces of the yogurt container could now be trapped somewhere in Carson's intestine.
Good boy.
Good boy, Carson. I'm gonna have a feel of his belly, hey? My biggest concern for Carson is that yogurt tub is causing an obstruction within his gastrointestinal tract. I can't feel anything, but it doesn't rule out that there's nothing sinister going on the inside, especially the fact that he's vomiting bits of container up.
He's rolling my prescription glasses and come home and there's glass.
Destroyed.
Yeah, destroyed about 3 pairs, and yeah, he's cheeky.
Well, let's go take an x-ray, hey? See what the x-ray tells us. What we need to do now is perform some diagnostic tests to assess whether or not there are signs of obstruction in his gastrointestinal tract. Are you ready, team, for x-ray?
Yep.
1, 2, 3, lift. Oh. And then on the side, good boy, Carson.
Good boy,
good boy. Good boy.
Yes. Right, I'll talk you through it, mate.
Okay, I'm going to slide you forward.
Good boy.
There we go.
Good boy.
And then-
Do you want more cream? Yep.
So the thing I'm looking for here is to whether or not there is indication of an obstructive process.
Oh.
Oh, he does have some distended pieces of intestine there. Now, hey, handsome man.
Come here.
I'm a little bit concerned, team. This should be a gas ball, but what we have is we have some kind of irregular opacity here, and my concern is he's got something in his stomach, and that's the reason why he's vomiting.
In the UK, Scott and his team are frantically working to save a huge litter of puppies being born by caesarean section to French bulldog Cardi.
Yay, I like that noise. I think we're at 8, and the fact that we've got 7 support staff means that we've run out of hands because some of them have taken a long time to recover. So I normally wouldn't recover puppies, but needs must. So thankfully Cardi's doing really well under anaesthetic.
I keep pulling out puppies and I see everyone working on their puppies, but more and more and more puppies keep coming out. I'm gonna have to start getting the guys running out in the street and getting passers by. Come and help us.
We've got 2 in here as well, so
it's 10 now.
It's 10 now.
As Scott and the team fight to save Cardi's puppies, her owner Sunaz and daughter Aria are anxiously waiting for word of their beloved family pet and her offspring.
So the kids are looking forward to seeing the puppies and seeing them grow. So we are excited both to see the puppies and to see Cardi come back to her usual lively self.
Any improvement on 4?
No.
But several pups are still not breathing, so the team is using ultrasound in the faint hope of detecting a heartbeat.
I still have seen something moving and I don't see any movement.
There's 4 which are doing well. There's 1 which is still occasionally gasping, but the other, I think 6, probably aren't going to make it, unfortunately.
Wow.
Right now there's 4 puppies that are breathing, which is great, but there's many more that aren't.
Keep rubbing it.
I know the team are doing their very best and working really hard, but there's going to be a few broken hearts out there if they don't get those little hearts beating.
Come on, just keep rubbing it.
You're giving me that look.
In rural Queensland, Alison is face to face with her largest ever patient, a 600-kilo bull called Boris.
I'm actually quite scared about this one.
Boris's left horn is growing dangerously close to his face and urgently needs to be trimmed back.
Well, it definitely looks like I have my work cut out for me. I am going to have to ring in the forces, phone a friend, see if I can get some help today. So though the procedure sounds quite simple, we really just have to remove a big chunk of that horn to make sure that it's not poking into his face. But actually the procedure of sedating him and getting him nice and restrained in a crush and also doing the nerve blocks is going to be a little bit more complicated, not something that I'm used to doing every single day. So I give my friend Malcolm a call, who's a large animal vet, and thankfully he's free today. So he's going to be coming straight here to help me. Okay, this is where Boris is at the moment. He thinks it's a piece of cake. I'm a little bit more nervous, but I feel happy that he's here today to talk me through it step by step.
Hey, big guy, how are you?
So as you can see, the left horn is the one that's dangerously close to that cheek. The right one's also growing downwards, but it's set further aside, so Brad's definitely worried about that left one.
Yeah, it's not touching yet, but I guess at some point it's going to start poking him in the face, which is going to be unpleasant for him.
Unpleasant and uncomfortable.
Yeah. My first impression of Boris is that he's a big lad. If he doesn't want to do something, it's going to be hard to get him to do it. Usually the easiest way with these big, thick horns like that, we use something called fetotomy wire or embryotomy wire. Yep. Some people refer to it as piano wire, so it just uses friction just to saw off the horn. Of course, he's not going to be all that keen on that, so we'll sedate him and also do a nerve block, because there is blood vessels and nerves down the horn, a reasonable distance there. So,
what is he doing?
He's just coming to say good day.
Okay.
The wire does get reasonably hot, so we'll sometimes cauterise the blood vessel. Not going to bother him too much, and it'll be much better than having a horn poking in the side of his face.
Suppose I've got to get you in the crush, though.
That could be the challenge.
Before he is sedated, Boris is being shepherded into a crush.
That's the way, Boris. Keep going, matey.
Which will hopefully keep him still during the procedure.
Beautiful.
Is he going to flinch?
Hopefully not. Oh, there's our problem when he does that. Okay, just draw back again, mate.
Oh my gosh.
Boris.
Boris! Before we start the procedure, we need to administer a nerve block.
So we're just going to put a whole bunch of local in here. Here we go.
So that Boris definitely won't be feeling any pain.
Oh, Boris. You're still alive, aren't you, mate? So if we get it in the right spot, it's going to block the nerves to that horn. So we just need to give that a little while to work.
Okay.
So this is the wire. Doesn't feel like much there, but it
Braided.
just relies on friction. So
Malcolm brings out the embryotomy wire, which is actually the device that we're going to use to saw the horn off slowly.
we'll try not to cut anything other than the horn.
This is really just a braided wire so that when we're actually doing the action of sawing, it's producing some heat which will naturally cauterize the vessels so we don't get a lot of bleeding.
Just initially, we just want to go slowly, just until we can sort of convince ourselves that it's making a groove and it's in the one spot. I think that's pretty good. I reckon you can. Right, Boris. Let's move your ear out of the road a little bit.
I'm a bit worried about that ear.
No, ear's all good.
The risk associated with the procedure is that we're not quite sure how much blood is going through those horns. There could be a lot of bleeding, there could be minimal bleeding, so we really have to be quite cautious about that.
Good. So you can really, so big long strokes now and harder and faster. Pretend you're doing your workout at the gym. We could be here a while.
I think this is 11. We've even got a receptionist, Will, working on all these puppies because there's just too many to handle.
In Isleworth, Scott has delivered the last of Cardi's 11 puppies.
So my one come out completely blue.
So far, only 5 are alive and well. Desperate to revive the others, Scott is using mouth to mouth to try to get the tiny newborns to breathe.
I don't accept no for an answer very often, so I want to try and get my hands on them and try and work on them myself for as long as I possibly can to give them the chance of life.
He's gasping, you need to make sure he's breathing.
But really, after half an hour maybe, if you're not having a breathing puppy, you probably won't get one.
Okay, all right, well, we're just gonna call it there, guys. No one did anything wrong. You all did your best. Just our best wasn't good enough on the day. So, yeah, it's very sad.
Out of a massive litter, little Cardi has safely delivered 5 healthy puppies.
Come on, my angel. Here we go. Ready, good girl. Come on then. That's it. Okay, through you go. Oh, baby, yeah. Come on then.
It's sleepy time for new mum Cardi.
Okay, good girl.
But no rest for Scott, with caesarean number 2, this time for English Bulldog Callie.
So, you know, that's a pretty mammoth task that we've all been through, but now we just need to suck it up and keep going. We've got another pregnant mum that needs help. So, yeah, we're going to have to go again and hope potentially for a better outcome.
An earlier ultrasound had Scott worried when he had trouble detecting any heartbeats from Callie's puppies.
Okay, Callie. Here we go. Happy, positive vibes. I think Callie is maybe like 4 puppies, which is much better. Having just less puppies means that each one's getting more nutrition, so we're just more likely to survive. But some of her puppies have got the sharpest of heartbeats, so.
As Scott begins surgery, Callie's owner Shana and her son Tyrone are eagerly waiting for news of their adored 3-year-old.
I think Callie's having 4 to 5 puppies. My youngest son is very, very excited and can't wait for the puppies to come. He's adamant that we're having them all. I've told him we need to save up and get a bigger house first.
Whoa.
Suddenly, something no one expected.
So it looks like there's just one mammoth puppy.
Callie, she's had a very different pregnancy to Cardi. She has this whopper of a puppy and then some strange other bits of fleshy tissue within the uterus, which would suggest that this guy did have siblings, but unfortunately they didn't make it through to full term.
Imagine just waking up and then someone doing that to you.
To everyone's relief, Callie's one very big puppy is doing well.
Yeah, so at the moment he's looking good. He's nice and pink. He's moving. He's shouting at me to stop rubbing him. So all good signs so far.
He really is incredible. So you know what? Callie might only have one son, but he is a stunner.
It's bittersweet today because, you know, we know we've lost, you know, a lot of Cardi's puppies, but thankfully she has still got some puppies to look after and love, and Kelly has her one puppy safe and intact. So, you know, as a team, I'm very proud of what everyone's done. It's a hard day, but we've all got through it, and we've got some happy, healthy puppy lives to look forward to. Makes it all worth it.
Good boy, Carson. Okay.
Boy.
I'm a little bit concerned, team. This should be a gas ball, but we have some kind of irregular opacity here.
Still on the Gold Coast, Gerardo is trying to find out what's wrong with 3-year-old Carson. It's feared the greedy Labrador has swallowed an entire carton of yogurt.
So next step now, ultrasound. Have a look in the inside of his stomach and see if we could see something there.
Carson, come on, mate. Boy, good man. Sit down there. Good boy, sit down.
Let's see if ultrasound gives us some answers, team.
Gerardo urgently needs to find out if any sharp pieces of the plastic container are blocking Carson's intestine.
He's a big puppy. It's not the easiest abdomen to ultrasound. Okay, mate. Okay, mate. Good boy. All right, team. I think it's all just in his stomach. Yeah, if it's been in for 3 days, it could have caused quite a lot of trauma on the inside. It's a good thing they brought him down. The rest of his intestine is empty. There's no obstruction there, so I don't think he's just further down. I think it's all just related to the outflow of his stomach.
Owners Maureen and Robert are terrified their special boy will have to undergo surgery. But first, Gerardo is going to try inducing Carson to vomit.
Good boy, Carson. I know, matey. Rub it on the inside your gums there. This is pretty potent stuff.
So good, you're holding your breath.
Oh. Okay, time to go hunting for treasure. Oh, look at that. It's heaps of plastic. Heap of cloth as well. He definitely ate the yogurt tub, and he decided to eat part of a tea towel. I can't imagine how that would pass through very easily.
A bit sharp.
It all came out in a ball, which is what I believe was what we saw on X-ray and ultrasound. So once he finishes vomiting, I'm going to go and repeat the X-ray and see whether or not there's anything else left in his stomach. Fingers crossed, he's brought it all up.
Put them in there. Let's go.
After a grueling caesarean birth, French Bulldog Cardi is about to introduce her new family of 5 to her human mum Sunaz and her daughter Aria.
Are you excited? Yeah.
Hello.
Say hi. All right, do you want to come and meet her babies? Yes, you little cutie. Come on. Let's go see them, shall we? So we got, how many puppies? We've got 5 puppies here. 5. They're nearly as cute as you. I'm not sure exactly as cute, but nearly as cute. We've got a good result. We've got 5 lovely, happy puppies.
Yeah, thank you so much. Thank you. Do you say?
Thank you.
You're welcome, my gorgeous girl. Delivering the news to Sunaz that Cardi had 11 puppies, but only 5 of them made it is a tough conversation to have. But at the end of the day, our focus needs to be on the living. We need to make sure that these puppies make it, and of course, make sure that Mum Cardi makes it too.
Thanks, bye.
See you later.
As Sunaz leaves with 5 new arrivals, Shana and son Tyrone eagerly wait to greet Kelly's new baby boy.
We're very excited to meet our puppy and we want to see what he looks like so we can think of names, don't we?
Yeah.
And here's the puppy.
Oh, look at him. Hello, my little cute. We are over the moon, very proud.
He's your beautiful boy.
Big head. He's stunning, absolutely stunning.
He is exquisite.
I'm in love with his colouring. Oh, wow, you are definitely mine. You're staying with me.
Oh, is that right?
Of course he is. He's the only one we've got. You're staying with me.
It's so nice to introduce Shana to Callie's puppy. It's such a beautiful moment. And although, yes, it's a bit of a shock that she only had one, she's got one healthy puppy. He's absolutely gorgeous. Come this way, beautiful. I know.
Mama's keeping the puppy.
I'm coming with the puppy. Don't worry, I'm not stealing him. Don't you worry. I'm so exhausted. It's the emotional exhaustion that comes with the roller coaster, which is bringing life into the world. I definitely need a good lie down. And will I do 2 cesareans in the same day again? Probably not.
Oh, look at that. It's heaps of plastic. Heap of cloth as well.
On the Gold Coast, Carson has just vomited, and it's time to find out if any sharp plastic from a yogurt container is still in his stomach.
I know you don't feel so good, matey. You sit here. Legs to us, Carson. On your side, matey. On your side. And... oh. Okay. What we can see is in the last ones, there was this structure here with some gas around it, and then that repeat X-ray of the same side shows nothing.
A very subdued Carson will be kept under observation for the next few hours.
Okay, so let's pop him on some fluids. Little one, bit more. Okay, I'm gonna trust you with the bowl. Are you gonna go for the bowl? Good boy, Carson. That's it, mate. Carson, you be a good boy and you keep that down, okay? And if you do, you get to go home. This is the way.
And 3 hours later, Carson has fully recovered, and it's time to be reunited with relieved owners Maureen and Robert.
There we go. He pulled me through the door.
Hey, gorgeous.
Did we go?
Hassie, you want to go home, mate?
I don't know.
Want to go home, okay?
I think you might want to stay. Good boy. You gonna go hunting some more yogurt tubs, mate?
Oh, no way. No more loaf, no yogurt.
No more yogurt.
No more tubs for you, baby.
You've got to be a good boy.
All socks, all socks.
All
No more.
socks. No socks or tubs or
And what's
keys
this,
or
what's
glasses.
this punk leg you got there, hey?
Yeah, that's where we place. So fingers crossed we don't see Carson again, hey?
That's good.
Thank you so much.
All right, thanks very much for that.
Appreciate everything you've done.
Okay.
You're going red, Alison.
Oh, you have no idea. Harder than it sounds.
Yeah.
Out in rural Queensland,
Keep going.
Alison has begun to saw through Boris the bull's horn.
We could be here a while.
With large animal vet Malcolm standing by, she has to work quickly and carefully. The 600-kilo steer is sedated, but not unconscious.
You're getting somewhere now, I think.
Oh, I can smell that.
Keep going. You're slowing down, Alison.
Mark.
Let me know if you want me to take over.
So getting actually that first groove started is not that hard at all. But when we get down to the nitty-gritty of actually getting those larger cuts through, I'm actually feeling the pain on my arm. Sorry, Boris.
He's not complaining. He's not feeling that one little bit. It's moving slowly. We're maybe halfway.
I'm just thinking, how can this be halfway through? I'm absolutely exhausted. It is a lot of work.
Nearly there, Boris. Beautiful. Good job, Alison.
So the horn's finally off. There's just a tiny little blood, so we're going to pop a bandage on there just to seal off the vessels, which will stop in time. Is it blue?
It's blue and pretty.
We'll also spray on some fly spray to get the flies away.
Bandage this on here. It'll just apply a little bit of pressure. I think that'll stay on long enough to stop the bleeding.
We're really, really happy with today. It's been very, very successful.
Oh, big fella. How'd you go, mate? Good boy.
There's minimal bleeding. It's good news for us, and it's really good news for Boris.
Good girl. Ready?
A few weeks later, Isabella and Miko are back playing at the park,
I know, it's so exciting.
but with a few new ground rules.
Miko, come here. We're doing 1 leash walk a day and then 1 trip to the park. But the park is nice and contained, not for too long. Just like Kate said, very minimal impact, too much energy. The happier that she is every day, the more joy she brings to our family.
Hey guys, look who I've got.
Oh, wow!
It's a month since Callie gave birth, and Shana has brought her new mum and baby Kenji to reunite with Scott and the team who brought him into the world.
What a good job you've done. Look at him.
Thank you guys for all your help and support throughout this whole process. You've been amazing.
Mum and son are both doing well, but like many new babies, Kenji is a handful.
It's really nice to see him and Callie playing together. Now he's at the age where he's running around the house and biting her, bless her, and she's just trying to get away from him. Yeah, it's very exciting. It's very nice.
There you go.
Coming to your mama.
Congratulations. It's a boy.
It's a boy. Thanks, guys.
All right. Oh, beautiful boy. See you soon.
Bye.
See ya.
In the UK, Scott's heading out of London to the English coast for an appointment with a very special patient.
Today I'm making a bit of an impromptu home visit of sorts to meet a friend of mine and his kindred spirit, his dog Jet. Hello, you two.
Ah, Scott.
Hi, Chris. How are you, mates? Good to see you. And you. Good to see you. Hi, how are you? Look, as much as I'm here for you guys, where's Jet? Where's the dog?
She's over there.
Baby. Hi.
Ah, she knows it's you.
How are you?
Former paratrooper Chris is walking the UK shoreline to raise money for the Armed Forces charity SAFA.
Well, man, you're looking so healthy. I mean, this walk, you know, it would kill most people, but for you, you've just gone from strength to strength.
Ah, surrounded by 2 good women. What else do I need to
Well, fair enough. That's true. That's true. That's true.
4 years ago, Chris was struggling and knew he needed to make a change in his life.
The walking started, essentially, I hadn't been in the best place. I was really suffering with a bit of anxiety and depression and always searching for something to do to be happy. But so, you know, I made a really kind of spur-of-the-minute decision that I'm just going to go and walk the coastline of the United Kingdom. Yeah, there's no doubts in my mind that all my family members, friends thought I was completely crazy. I literally set off with £10, 2 days worth of rations, about 2 days after deciding I was going to do it. Jack, come on. Jack, come on.
9 months into his journey, Chris's life began to change when he rescued 9-year-old Jet.
Meeting Jet was a huge turning point in my walk. It's all of a sudden that focus shifting onto someone else and having somebody else to care for was an absolute game changer. Jack, come on. Jack. For my mental health, that was massive. What she'd done was just gave me somebody that I knew completely and utterly was devoted and loved me and gave me the space when I needed it to figure things out for myself. Come on. She made me smile every day. I wasn't like that before. Can you grab your side then? No, the other one. That's it. Got it?
Yeah.
18 months later, Chris and Jet were joined by fellow adventurer Kate.
I think I first fell in love with the bond, you know, that Chris and Jet have, because it's just so unique, so remarkable in the way that they are never apart. They spend 24/7 together and they just emotionally can't bear to be without each other.
Where's it go?
The change that's come over Chris as a result of having the relationship with this dog is truly transformative. His joy is back, his self-confidence is back, and he's learnt to love again.
But Chris's newfound family bliss could be in jeopardy, as the couple have recently found a worrying lump on Jet's chest.
Scott very kindly offered if you have anything wrong with Jet before, then just let me know. You know, as soon as we found out, we told him, and just like that, man of his word, you know, he comes straight to us.
Now, Chris, you mentioned that she had a lump on her mammary tissue. So, sorry, sweetheart, I'm just going to have a little bit of a feel of your breast tissue. Yeah, I'm worried about this. Actually, I can feel multiple lumps.
Yeah. Oh, my word. That must be quite new, because we really checked.
Probably means that they're developing quite quickly. Unfortunately, I would probably prepare yourself. It's probably going to be some kind of cancer, I'm afraid. When there's multiple lumps, you'd have to start worrying about the possibility of cancer.
Yeah.
A bit frightening, I know.
Oh, she's in good hands, mate.
Yeah.
Oh, I'm gonna have to go and take a minute, sorry.
Jet, she is everything to him. He loves this dog, and straight away I see that his heart's broken. Unfortunately, there is a real dark cloud that's lingering over this family right now.
In Sydney, Audrey is making a house call to check on young Groodle, Zeus.
Hi, Dr. Audrey. Thanks.
Zeus's owner, Danielle, is concerned her adventurous puppy has done something serious to his paw.
Hi, Danielle. Oh, Zeus.
Hi, Audrey.
What's happened?
Oh, he jumped off the couch and he screamed and yeah, we're just really worried that he's really badly hurt himself.
Yeah, is he putting any weight on it at all?
No, when you put him down, he screams and he hops, yeah.
I can see he's really licking it there, really guarding it. All right, Zeusy, can we have a look? Oh, come on, buddy. Oh, I know, it's sore. Oh dear, well, he's really protective of that foot, which tells me it's really sore. We might have to just pop his head away so that I can have a good look, and I might shave it up just to see there's no open wounds.
Okay.
But just hanging there, it doesn't look like it's in a really good position. I'm worried there's a break there of some sort.
Okay, all right.
All right, let me just
you.
grab a towel and we'll see if we can give that a go. Hey, it's really sore, isn't it? Oh, I know. Oh, don't bite, Mummy. Yeah, well, it's all right. I'm worried because a break in a puppy's paw could be quite serious. If it's across a growth plate, that might affect his growth, or if it's shattered into a million pieces, then we may not be able to save the paw and we may be risking infection. Oh. We're guarding it, aren't we? It's very painful. Oh, come on, buddy.
Hello, look how sad you are. How did you get so sad?
At Kate's Bondi Vet Hospital, Simon has rushed in with his unusually subdued Doberman, Ben.
Tail between his legs, that's unusual for him.
Yeah, so unusual.
Benny is one of Kate's regular patients. Today she's alarmed at the dramatic change in the young dog.
Let's go this way. Come on, Benny.
Ben hurt his leg, so he's been walking funny, and he seems like he's just very out of it, where he's usually really quite happy. He comes here a lot. But he just walked in really quiet and somber, so there's definitely something not right.
Okay, so let's start at the beginning.
Yesterday, we were playing in the garage and he had a fall, like he fell, I heard him yell. He hobbled a bit, walked it off.
Right back?
Yeah, he held it up. Yeah,
yep.
And then he walked it off and I was like, oh, okay, he's fine. And then my housemate called today and said, oh, he's not moving. And then he started shivering, so I was like, okay. And I've never seen him with his tail like that.
No,
and you've seen him a few times, like he always has so much energy.
Kate's baffled when she hears Benny's symptoms. It's unlikely a leg injury would cause such a dramatic change in behaviour.
This is not like him at all, is it? Benny.
What I'm feeling here is, multiple lumps along the sort of lymphatic chain of her breast tissue, and it's in multiple locations. So I think we need to address it really quickly.
In Essex, Scott is delivering devastating news to charity walker Chris and his pregnant partner Kate that their constant companion Jet has a life-threatening illness.
Oh, darling.
You always hope that it's not as bad as you suspect. Like, we were hoping for a best case scenario, not a worst.
Giving Kate and Chris the news that I can feel multiple lumps in their beloved dog Jet is heartbreaking. This dog is the centre of their universe. And I think we have to be really brave. And I know you're a really brave guy and you've done a lot of amazing stuff. And I know you've done it with this dog and I know how much she means to you. So I think we can't really delay.
After 4.5 years on the trail, Chris and Jet's heroic charity walk around the UK coast could be over.
Naturally petrified, yeah. You know, of course I am. Yeah, I've already had a couple of tears and stuff like this. I love that girl, and obviously she's priority. We stop the walk there and then.
The quicker we can get these types of tumours out, the better chance we have. There's some cases where, yes, they've already spread. Oh, don't look like that, Jet, honestly.
I know, it's like...
Look, it's like she's awful. She's heard me. Like with any cases of potential cancer, you need to act quickly. You need to respond to the lump by investigating it thoroughly and, if possible, removing it as soon as you can.
So tomorrow it is then?
Yep, tomorrow. Yeah, so have a good night's rest. Tomorrow, surgery.
Yeah, all right.
Okay. Yep.
Thanks, buddy. Together we can make this happen, all right?
So
You
much.
guys all right? You're all good. All good. We'll get through.
You.
You're welcome. You're welcome.
She brings so much love and joy. We couldn't imagine, you know, doing this walk without her. She's a big part of our hearts.
Today, Alison is making a long drive out of Brisbane after an urgent SOS about a sick pet goat.
It's a bit of an adventure trip today. We don't usually come out this way, so I'm excited to see what today will bring. Hi Joanne, how are you?
Good, thanks Alison, how are you? You too.
Gorgeous property, it was a good drive.
Yeah, it's lovely out here.
So I hear we have a bit of an emergency with the goat.
Yes, she's not real good, so...
Oh dear, okay,
Yeah.
well we better go off and have a look.
Okay.
What's her name?
Shazza.
Shazza, okay,
Yeah.
let's go check on Shazza.
She had twins 3 days ago, but she does have trouble feeding them, I think, at this point. I just think she's in a bit of pain, so she seems to kick them away sometimes, so I'm a bit concerned that they're not getting enough milk off her.
Hi Shazza. The first thing I notice about Shaz is that she's very skinny. She's quite underweight. I can see her bones, her ribs, her pelvis sticking out. So she's looking quite poorly. Not much of the loin muscle there. She's lost quite a bit of condition, which is not unusual when they're feeding. But that is not normal at all on that end. So I see one functional mammary gland. It's obviously full of milk. She's very upset with me holding it. So when I go around the back, I can actually see that her mammary glands look very, very unusual. One of them is actually looking quite normal for a lactating goat, but the other one is quite firm, hard, is really retracted up, and there isn't any teeth there. So the left side where the teeth's intact, it's not firm, it's not hard, there's some give there. Got milk, but this right one is very abnormal.
This is Shaz's second pregnancy. She had the first little goat stillborn, and her nipple went black and fell off.
How long ago was that?
About a year ago.
About a year ago. I think the problem is now, because that mammary gland is still there, although the teat is missing, there's nowhere for the milk to drain. So it's actually got really hard and firm. Good girl, you're allowing me to feel that now, aren't you? It doesn't actually feel like there's fluid in there. It almost feels like a hard mass. When I actually have a feel of that right mammary gland, I can feel that it's really hard, it's multilobulated, it's very firm, it's very warm, and there's actually no teat there, and that's because that fell off a year ago when she had that stillborn. So it feels like something is going on that's very, very bad. Okay, so I'm really concerned about that right one. It's really firm and hard, really warm. There's definitely infection going on there.
Yesterday, we were playing in the garage and he fell. I heard him yell. He hobbled a bit and then he walked it off and I was like, oh, okay, he's fine. And then he started shivering, so I was like, okay. And I've never seen him with his tail like that.
In Bondi, Kate is trying to piece together what's happened to Simon's Doberman Benny and find out why the young dog is so lethargic. A nurse has come in to assist so Kate can carry out a full examination.
Let's just pull him slightly this way so I can get behind him. Okay, let's just start at the beginning. Just having a look at how he places his feet. Okay, so this is left back. We've got a movable knee there. Whether he's done a cruciate. Blind Freddie can see that there's something wrong with Ben's leg. His right hind leg, he's really lame on it. He doesn't say much, does he?
But Kate's not convinced a possible leg injury is the cause of Benny's extreme drowsiness.
Is he trying to fall asleep? What's going on here? Every single patient that comes through the door, I go nose to tail, and that means I look at every single small detail, despite what the owner tells me. It is so easy to miss something in veterinary medicine if you don't be thorough. So Ben has papillomavirus. That is not the reason for him being lethargic today and why he's here. But we've seen you before about your papillomas, haven't we? There you go. Stinks. Do you smell something that stinks? Yes, there's something infected around here.
Yeah.
Do you smell that?
Well, I wasn't sure if that was his mouth.
Something wrong with you, Ben?
As Kate continues her examination, the list of worrying symptoms continues to grow.
It's boiling. 40.1. Why are you so hot, mate? 40.2. He's too hot. Things are just not making sense. He's got a temperature. His temperature's at 40.3, which is ridiculously high. He's mentally dull. You see him tremoring, like he's shaking. He seems like he doesn't really know what's going on and all he wants to do is sleep. There is something going on with Ben that is not related to his leg. No possibility that he would have had any drugs, right?
No.
Is there anything that you can think of that he could have gotten hold of?
Oh, not at home.
Would he be the type that eats something off the ground?
Yes, yeah. And I try to watch it so much, like I don't even, like I'm on him all the time.
I'm going to run a drug test anyway. We need to be thorough, we need to be systematic and try and figure out what's going on. Good boy. To me, he looks like he's tripping. Yep, he's not going home. So first thing, let's take some blood, start getting them run, because I want to figure out what's going on. He stinks and his temperature's really high. Yeah, it's weird. Like... I know, sweetheart. Come on, let's get going.
Hey, it's just tickles.
To rule out any form of drug poisoning,
Okay, excellent.
Kate is carrying out urgent blood and urine tests.
So far, we've got negative for cocaine, amphetamine negative, benzodiazepine negative, positive for THC. He's got cannabis toxicity. Benny.
In Isleworth, Chris and Kate have brought in 9-year-old Jet for emergency surgery after Scott diagnosed probable breast cancer.
I haven't really slept properly for the last 2 nights. I even had a bit of a panic attack on the way down in the car.
For more than 4 years, Jet and Chris have been inseparable during a challenging charity walk around the UK coastline.
Hi guys.
Hey, Scott, how are you?
Hey, you guys all right?
Yeah, nice to see you again.
And you. Hi, Jet. Oh dear, I'm trying to think who looks more nervous, you or Dad?
Definitely Dad.
He's fine, look, totally oblivious.
Yeah, hi baby. So it's a big thing we're doing, and I know it means that I'll have to separate you guys from your girl for a little while, but you actually will get to come down and be with her until she falls asleep. That's perfect.
Yeah, thank you.
Which I think she'll be appreciative of too. It's not normal procedure for us to have owners in the clinical space. It can just be an upsetting process. But in the case of Chris and Jet, this is a relationship that's forged over 4.5 years. They are so close. I thought it's best that we get Chris by our side.
It's okay.
Oh, there they are.
It's okay.
Yes. Where's Daddy? Where's Daddy? There he is. That's a good girl. Oh, you're so good.
Oh, Jetty, we'll see you on the other side, mate.
Night, Jetty. You'll dream of lots of treats.
Not what you want to see, is it?
We'll take very good care of it, don't worry.
All right, we're leaving, sir. Okay.
Yeah, thank you so much.
You're welcome.
Are you gonna just give us a call when?
Give you a call. I will. Yeah. All right, take it easy. Bye, guys. How much does that guy love this dog?
The nature of our relationship together, we're just together all the time, so even just not being with her for this is going to be horrid.
Jen, can you just hold that for me there, please? 27.3.
Just moments into the procedure, Scott makes an alarming discovery.
She has the slowest heartbeat I think I've ever heard.
It doesn't actually feel like there's fluid in there. It almost feels like a hard mass. Really warm. There's definitely infection going on there.
In rural Queensland, Alison is trying to find out why new mum Shazza is so unwell and unable to feed her babies.
That nipple obviously got quite infected, necrotic, possibly gangrenous, and just fell off. So that blackness that you saw is usually a sign of really, really bad infection. So there's a couple of things of concern. I mean, the fact that she's got those babies to feed, that's probably putting a lot of stress on her, and stress can make infection worse. The problem is, if Shaz is producing milk from that right mammary gland, there is no teat for that milk to come out. So it's building up in there, and it's causing a mastitis. Mastitis in itself is a life-threatening condition if it's not treated, particularly if it goes to the extent that it's causing gangrene or necrotic tissue. And the problem is, if that infection gets into the bloodstream or seeps through the body, we could be dealing with a septicemia, so infection that takes over the whole body, and that can certainly kill Shaz. So we're not at that stage where it's black like it was last year, but it certainly is quite hard and swollen. When she's lactating to this extent, they need to be on quite high energy food, but it's still not enough to produce that much milk. And if she's having that increased demand of two of them sharing one nipple, she's going to be overworking to try and produce enough milk. I mean, there's only so much she can make in that one mammary, but with her, she should be using two, not one. I don't think that this left one is infected. That right one is a huge problem, and it's sort of the chicken and the egg. We don't know which came first. So unfortunately, I can't get a milk sample from that right mammary gland because there is no teat there. So I'm going to have to perform a fine needle aspirate. And it's where we introduce a sterile needle into the sample that we want to test. We extract some cells via the syringe, and then we spray that onto a slide. Got it! And then we're going to have a look under the microscope, particularly in this case, to look for what bacteria is there and what cells are there. Straight away, I can see there are thousands of what we call gram-positive cocci, which is typical of a staph infection. I wouldn't be surprised if we're dealing with a Staph aureus infection, which is typical in mastitis. I'm tempted to start her on just some broad-spectrum antibiotics because there's definitely infection there. It's firm, it's hard, it's really hot. It does mean in the long term that you're going to be bottle feeding, which is quite intensive, unfortunately. Probably not a good idea that she has any more babies in future because this will always be a problem. I mean, worst case scenario, if that infection does not come good with just the antibiotics, then we might need to look at removing that mammary gland altogether. So now that we've had a look at Shaz, I'm going to turn my attention to the kids because from the way Shaz looks, they could potentially be very malnourished. They're so tiny and small. So when I first meet the kids, they're absolutely adorable. There's actually two girls. Hi, gorgeous. They're both extremely skinny. I can feel their ribs. So my concern straight up is that the two kids are not getting enough milk. Each kid should be able to suckle off both teats, but there's only one for both of them to share.
Yeah, they're both fighting over it, aren't they?
And there doesn't seem to be like there's much milk in there to begin with.
I mean, they latch on, but there's not much in there for them to stay on.
This can be quite life-threatening. They don't have enough milk, they don't have enough nutrition, so they will be quite underfed, quite skinny, and they could be malnourished and eventually die.
They're starving, you poor things.
Come on, buddy. Oh, I know, it's so...
Oh. In Sydney, Audrey is trying to get a good look at Zeus's injured paw after the young Cavoodle jumped awkwardly off a couch.
Oh.
But Zeus isn't too keen on an examination of his painful paw.
Alrighty, I've got some reinforcement. If you can just lift him for a second. We gotta make you forget about that for a little bit, don't we? I know, it's sore. Can Auntie Audrey have a look at it? Okay, good boy, good boy. So I'm just gonna have a feel of it. It looks very sore, and I'm just gonna shave a bit of hair to make sure there's no open wounds there or anything that might be causing the pain. Oh, oops, he's out. Hello. Oh. Good boy. Being brave. Good boy, Zeus. So good news is there's no open wounds, but he's definitely hanging that wrist in a very unusual angle.
Okay.
And there's a bit of swelling just on the inside as well.
Yep.
So I'm worried he's got a break in one of those little bones in his wrist.
Okay.
All right, so best thing is we take him to the hospital,
Okay.
do some x-rays of his paw, and then depending on what we find, I'll give you a call.
Okay, perfect.
All right.
Thank you.
But it is very sore, so I'll give him some pain relief as well.
Glad that Audrey's taken Zeus away. We're just really worried about him and want him better and fixed. Okay,
Say bye,
perfect.
Mummy.
Thank you. Bye, Zeus.
An x-ray will give Audrey a clear picture of just how badly Zeus injured his paw.
You're being such a good boy.
Vet nurse Iona will be assisting.
Hi, Iona.
Hi.
This is little Zeus. The plan is to get him into this cradle position, rock him gently to sleep, place him on the table, and hopefully get that paw in position that I can take a good x-ray. So left paw in an AP view. Good boy. That's a good boy. Oh, I know. Good boy.
Despite the pain, Zeus is remarkably relaxed, but he still needs to be manoeuvred into exactly the right position and kept still enough for an x-ray.
I've got the paw. You want to just concentrate there? We've got Zeus into position. We're slowly cradling him and rocking him to sleep on the x-ray table, and hopefully I can get that paw in the perfect position to take an x-ray. We managed to get an x-ray of that paw, and I'm really, really hoping that we haven't got a nasty fracture there, no signs of infection, or that there's many, many little fractured bones that we can't repair, can't splint, and maybe would have to look at amputating the leg.
Wow. Look at that. Wow, that's pretty bad.
Buddy, that's gonna hurt.
Jen, can you just hold that for me there, please? She has the slowest heartbeat I think I've ever heard.
In Isleworth, Scott has detected an abnormally low heart rate in 9-year-old Jet.
Should we reverse some of the Domitor?
Right. It's so low because she's an athlete. She's just so fit. To keep that in mind, not worry.
Do you need help? Or you...
Nah, it's all right. I'm all good.
With Scott reassured Jet's heartbeat is normal, he now needs to check that the cancer hasn't spread into any other parts of her chest.
X-ray. When we consider removing a cancerous growth, we want to make sure that the horse hasn't already bolted. And in this case, one of the first places that a tumour will spread to is the lungs. And everything is looking okay, so we can now move forward to surgery. It's a relief to see that Jet's chest is clear. It doesn't mean that she's out of the woods yet, though. So you can see very clearly the mass that Chris could feel here, but actually rather than it being one mass, it's a series of smaller masses. They're even going down in here. I can feel them underneath my fingers, and then this whole section here. So it's a decent amount of tissue that I'll have to remove. There's lots of things that I see here that I don't like the look of.
Probably not a good idea that she has any more babies in future.
In rural Queensland, new mother goat Shazza is desperately unwell with a badly infected mammary gland. Alison is concerned Shazza's twin 4-day-old kids are also extremely malnourished.
Yeah, they're both fighting over it, aren't they?
The twins will have to be bottle fed if they have any chance of survival.
They've never had a bottle before, so that's going to be the tricky part of today, is trying to get them used to the bottle and getting milk into their system so they can grow nicely and gain a bit more condition and weight.
We are going to try bottle feed you. Hey? See if we get any luck with this. Yeah, Mama? I'm gonna give them some milk so you don't have to work so hard.
Joanne's son Jake actually comes and helps me bottle feed because he's going to be doing that tonight. So he's been preparing the bottles and we're going to try feed the little kids together.
Here you go. I know. Oh, is that good? Is that good? You're hungry? You're hungry.
Yeah, she's not really liking it.
Oh, baby. No?
So the kids aren't really liking the milk that we just tried. They did have a little bit of a suckle, latched on, which is great, so we know that they can do it. Had a bit of a feed, but after a couple of suckles, wasn't as interested. She's very, very hungry. We just really need her to eat, so we're going to try a different formula and see how she goes with that one. So fingers crossed. Oh my gosh.
Good girl.
So this is a win. It looks like the new formula has worked. This was the smaller one. She's very, very fussy. So this is a good sign, a very good sign.
All right.
Yep, that's what we're feeding your babies. It's not bad, is it?
Oh, okay.
It makes me feel absolutely awesome. There was a moment there I was really worried about what are we going to do if they don't take the milk, but finally we've managed to find a formula that they'll take and a bottle that they'll take, so that makes it easier for Jake and Joanne to continue doing this once I'm gone. Can I share it with your sister? Oh no, okay, all right. You're gonna have to open your mouth.
With the twins finally getting some nourishment, Alison now needs to help save new mum Shazza.
So he looks like he's positive for cannabis, or THC. So that explains quite a lot, right? Explains our temperature, explains why he's shivering, why he's so sleepy.
In Bondi, Kate has finally discovered why Doberman Benny is so lethargic. He's tested positive for cannabis, a drug that's much more toxic in dogs than in humans. Even a small amount can cause dramatic fluctuations in blood pressure and heart rate.
So what I'm going to do with him is I'm going to get him started on some IV fluids ASAP.
Sure.
I'm going to keep him for a little while.
Okay.
Can you walk, buddy? He seems to be getting slightly worse. Come on, you want to get up? Okay, we're going to take you through to bed.
With Ben super relaxed and sleepy from the cannabis, Kate wants to further investigate the possibility he may also have a leg injury.
Just lying down like this. Good boy. X-ray. Sort his situation out. So there's some inflammation in that joint. So this is all swollen around here, this little leg. I also don't love that situation.
The images will be sent off to an orthopaedic surgeon for further investigation.
This is Ben. He ate cannabis.
Ben will need to stay under close observation at the vet hospital until the cannabis wears off.
You're a good Doberman. Yes, you are. You're a good baby Doberman. Yes, you are.
There's lots of things that I see here that I don't like the look of.
In the UK, Scott is about to perform surgery to remove a series of potentially cancerous lumps from 9-year-old Jet's breast.
It's going to be a little bit tricky because it's quite big. There's multiple lumps. What we like to do in the case of malignant tumours is to give what's called a margin, which means that if there has been some spread of cancerous cells, you can pick them up by removing a certain amount of tissue from either side of the lump. The challenge here is that some of these lumps go all the way down, so I won't be able to remove enough to be confident that I've got all the margins. The surgery is massive. The incision line is huge. Everything about it is on a grand scale. There's a lot of potentially cancerous tissue on Jet that I'm trying desperately to remove. All the masses, which is great, in one clean piece, and I can see the tumours now. They're quite dark in colour, and there's many of them, but they're all gone. I've checked, there's nothing else there, so now it's all about closing her up. That was as epic a surgery as Chris and Kate's journey's been. It doesn't mean that she's out of the woods, but everything that I thought was something to be concerned about, I've taken away. So hopefully I've taken away some concern from Jet and Chris.
Scott's been able to remove more dangerous tissue than he originally thought possible.
Hey.
What a good girl.
But owner Chris and partner Kate will be on edge until tests confirm whether or not the lumps are cancerous.
Hello, girlie.
Steady, so she's a bit sore, Dad.
Oh, hello, girl.
Hi. While I'm performing the surgery, I'm very worried about Chris as well and about the fact that he may not recover from the fact that Jet might not recover. They have such a close bond. It's quite a worry.
Hey, girlie, you're going to come home soon. What a relief to know that it went well.
Yeah.
So grateful, honestly, can't tell you.
That was the longest 3 hours of my life, that was.
Was it?
We literally just stayed outside the whole time. We just sat outside the surgery for the whole
Yeah, just sat in the car, just in case. It's all right, darling.
Doctor's orders, I'm afraid your epic journey is on hold as we focus on Jet's recovery.
Yeah.
Unfortunately, I am going to have to put the stop on their epic journey. Jet needs to recover from this major operation, and I think Kate needs a bit of a break as well. She is 7 months pregnant after all. Enjoy 10 days off.
Yeah.
Give all your love and attention to her. Now she's on the road to recovery, and we just need to wait for the results, so fingers crossed.
Oh, look there.
Oh, wow.
Hey, buddy.
In Sydney, Audrey and vet nurse Iona have just x-rayed puppy Zeus's paw to assess the damage after he jumped awkwardly off a couch.
2 big clean breaks across his metacarpals, but everything else looks okay. I was really worried he had a few fractures, like completely shattered there, but actually if you were gonna get a break, that's a pretty good one to get. It means that we can splint it, and you've missed all your growth plates.
Lucky.
Very lucky duck, hey? So plan is we will splint it.
You ready for that? It's gonna be a long journey.
Whenever I do a splint, I want to make sure that it's nice and firm and it's actually protecting the area that's unstable. Let's just pop these between your toes. But it also prevents him from moving those bones too much so they can heal properly. All right, so I made a splint. It's going across his wrist and a little bit higher up, just so he can't move that wrist at all. And we want to kind of get him to use this like a walking stick while that bone heals.
Very good. Not a good boy.
Okay, looks a bit overkill, but we kind of need it so you can't bend your foot. Oh, big yawns. Yes, you know we're done. There you go. Take it for a test run. So splints on, bandages on. I really want to see how he goes walking on the ground, so we're going to take him for a test drive on the grass.
Oh, come on. Okay, slow down.
Good boy.
Okay, slow down.
Come on, come on. Yeah.
Zeus seems to be walking on the splint really well. He's happy, he seems comfortable, the pain relief is working. So happy to send him home, check in on the bandage every 2 or 3 days. He's got to keep that on for 6 weeks. So if he's a good boy, those bones should heal perfectly. And I'm sure he's going to make a great recovery. Prognosis is good.
Let's go, let's go, let's go, let's go.
So how's the patient?
Yeah, she's been amazing.
Hi, gorgeous girl. How is the wound looking now? Is it kind of looking like it's healing?
Yeah, 100%.
It's been 12 days since Scott's patient Jet underwent massive surgery for extensive lump removal.
Great. Yeah, really good.
Now it's time for Scott to give Chris and Kate the all-important test results they've been nervously waiting for.
This stage, it looks like all the tumour is out. The news is that it has come back as a malignant type of tumour. The positive thing is that by removing all the tissue that I did, healthy tissue surrounds all of the areas where we found cancerous cells.
Amazing.
So
That's good news.
it's really good news.
Absolutely. Oh, that's amazing news.
Oh my gosh, I can't tell you how happy we've been.
Virtual man hug, please. Virtual man hug.
Virtual man hug, definitely.
I know.
My advice to Chris and Kate is that given a few days and the staples be removed, Jet should be able to return to her journey, traipsing around the UK coastline. She needs to go back to what she loves. It gives her an amazing quality of life. I'm glad to get your canine companion back on the road.
Thank you, and we look forward to seeing you at the finish line, Scott.
Oh, I'll be there. Bells on.
Look after yourself. Take care, Scott. Thank you. Bye.
Bye, guys.
3 weeks later, Chris, Kate and Jet resumed their epic walk around the UK. And now a very special fourth member has joined the expedition. In rural Queensland, Alison has come to the rescue of sick new mum Shazza and her 2 kids.
Can I share it with your sister?
The malnourished babies have been successfully started on formula. Now it's time for antibiotics for Shazza to help clear up her infected mammary gland.
Oh, good. Wow. You just wanted to see your mate. That's all she wanted, was him. She's okay. She just had a needle. So today I've given Shaz an injection of an antibiotic, and that antibiotic is quite long-lasting, and it will combat staph infections nicely. She keeps backing up. I'm sorry, I'm gonna have to straddle you. So I'm also gonna give her an oral anti-inflammatory pain relief because she's in quite a lot of pain. All good. So we have Mum Shaz and Dad Gaz. So we've actually got to think of a name for the 2 baby kids. They haven't actually had a chance to think about names. And because they're twins and they're girls, I have suggested to Joanne that she consider the names Audrey and Alison, because we're twins and we're girls.
Oh. You got me.
So out of the 2 baby girls, one definitely has a little bit more attitude. She's a little bit more feisty. She's also a little bit more stronger. So immediately I think that one's got to be an Audrey. And the cute little small one that actually falls asleep on my lap and is really gentle is an Alison, just like me.
A week after Kate diagnosed cannabis poisoning in Doberman Benny, the young dog has made a full recovery. And in more good news, his limp has improved and his x-rays have come back all clear for joint problems. Lively puppy Zeus is coping well with the large splint on his injured foot. His bones are healing well, and Audrey is confident he'll fully recover with no long-term issues.
I'm a bit concerned about what is going on here.
On the Gold Coast, Gerardo is dealing with a major emergency.
We'll help you out.
Heavily pregnant Storm is in labour with a huge litter of puppies.
Now, you're a sweet soul. We'll take care of you today, hey?
Owner Jessica rushed Storm to emergency when she noticed her beloved dog's labour was not going smoothly.
This morning I could see that Storm was in labour with her puppies, and I could see contractions in her belly, which was very exciting. But after a little while they stopped, and it didn't look like things were going very well, so I thought I'd bring her down just to be checked out, and I'm very glad I did.
But today, she started passing green discharge and having contractions. If she has green discharge, that means there's a separation of the placenta from the uterus wall, and that puppy is at risk of passing away because blood supply nutrients will start to become compromised. I'm just going to check and see if she's got some milk coming down. If she's got some milk coming down, it helps us know that she's ready. We got some milk coming down. That's always a good sign, meaning that she's getting ready to give birth. Good girl, Storm. There we go.
Gerardo needs to quickly decide whether to try encouraging Storm to give birth naturally or go straight to an emergency caesarean.
Stay still, stay still.
Sit back.
Good girl.
Hey, Bobby, come here.
Oh, you little...
Storm needs an immediate ultrasound so Gerardo can get a better idea of just how many puppies she needs to deliver.
Whoa, slow down.
But an already nervous Storm is becoming increasingly agitated.
Okay, hold your little fancy.
Oh.
No. She's jumping.
Here he is.
Hello, gorgeous boy. What have you done?
At Scott's Isleworth practice in the UK, worried owner David has rushed in with 6-month-old Colin after the kitten suffered a mysterious accident.
Look at you, you silly boy.
He's been going outside for 3 weeks, and when I got home today, this morning, I basically found him in my bedroom cupboard, cowering in the corner. He's clearly in pain. It's a horrible thing to see. You know, he's got so much love in him. He's like part of my family.
X-rays show all too clearly just how much damage the tiny kitten has done.
You can clearly see that the head's not attached to the femur anymore.
Wow. He's done a real job on himself, hasn't he? Ouch. Poor little Colin has suffered a major fall, and he has quite a significant fracture. It's basically present in the femoral neck, which attaches the ball of the ball and socket joint, which is the hip joint, to the hip bone, which is the femur. Let's just see what we've got here. So that's the leg you don't want to put down, isn't it, mate? Yeah, so very, very tender. Just really doesn't want that to be extended, does he? Oh, buddy. Poor thing. Well, we've got one good leg, and we can fix this one. Cats are so tough, they're so resilient, and they'll put up with a lot of discomfort, but it's very clear that this poor little kitten is suffering, and the injury is severe. So he's really young, isn't he?
Yeah, he's 6 months old.
Should we
Yep.
give him an anaesthetic and get him on his way?
Scott is going to have to perform urgent surgery on the tiny kitten to try to give him a fighting chance of regaining use of his shattered hip.
The procedure that we're going to be performing on Colin today is called a femoral head and neck ostectomy. We're basically going to be removing the ball of the ball and socket joint, so his hip will then be free floating. It is a major surgery. Just a scalpel blade, please. What's quite scary is behind the hip joint is some really big blood vessels and some very important nerves. And if you happen to go through and cut them, then there's a chance that Colin will be paralysed and also could bleed out. So, yeah, there's some concerning bits of structure that I need to avoid. Oh, buddy, poor thing.
On the Gold Coast, Gerardo is urgently trying to prep heavily pregnant and extremely anxious Storm for an ultrasound.
She's jumping.
The 2-year-old Border Collie's labour has stopped, and if she can't deliver soon, her puppies will not survive.
Storm clearly prefers to be on the floor. Now that she has calmed down, we can take her through to X-ray and have a look and see what's going on the inside.
Yeah, legs to us. 1, 2, 3. Oh, so still, there we go. Oh, there we go.
What the X-rays are going to show us is the number of puppies that are in there.
Oh, it's a lot of puppies in there.
You're a clever girl, Storm. You could have
PD.
8 beautiful babies, hey?
It's a lot of puppies.
Storm won't be able to deliver naturally if any of the puppies are too big for her birth canal.
Now we've got to look at the pelvic canal. So the pelvic canal is 3.5 centimetres. Let's have a look at some of these noggins. 5 centimetres. 4.5 centimetres. Oof, it'd be tight. It'd be tight. They may not fit. We may not fit. Here we go. Stormy, 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 stormy.
It will be a tight squeeze for the puppies to come out, but Gerardo is still hoping Storm can deliver naturally.
Let's just make sure.
Next, Gerardo needs to check the puppies' heart rates.
If the puppy heart rates are above 180 beats per minute, then we're pretty happy. If it's under 150, that means that those puppies are in trouble.
And let's just get a heart rate on this little fella.
Wow.
Boom, 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 boom. Pause. Heart rate is looking at 153. Yeah, that's not so great. Let's try and find another one. And that 150 is a bit concerning. Okay, we have another one here. Heart rate. This is not as good as I hoped. This one is looking very slow. You know, let's measure it. Thank you. Come on, come on, come on. That's not good. That's one, 147.
Storm and her puppies are in trouble, and Gerardo needs to take her straight through for an emergency caesarean.
We may not have an option to try medical management, hey?
A bit worried, darling.
Yeah.
That's the leg you don't want to put down, isn't it, mate? Yeah, just really doesn't want that to be extended, does he? Oh, buddy. Wow. He's done a real job on himself, hasn't he?
In the UK, Scott is about to perform major surgery on 6-month-old Colin after the tiny kitten fractured his femur. It's delicate surgery on such a tiny cat.
That's the fracture site there, and then we've got the head. The added difficulty is that the femoral head is attached to the pelvis with the round ligament. So it's almost like if you're bobbing for apples, but the apple is tied to the bottom of the barrel. Still holding on by a little thread. There we go. So there you have it. But that's the tricky bit, you see, because that's blind, so you have to get behind it to cut it.
It's a relief that the first part of the surgery has gone well, but now Scott has to work on the end of the femur that the ball was connected to.
So this bit here is where the fracture was. So what I'm trying to do is now I've taken the ball away, then this bit I just want to smooth off, just so it's nice and smooth. It doesn't touch Colin's pelvis, and he's a very comfortable boy. You know, this poor boy's been through enough. The last thing he needs after this surgery is to be uncomfortable still. So just got to get it right for him, because this is the rest of his life, you know.
Colin will have what's called a free-floating hip, where his leg is no longer attached to his pelvis.
I can imagine that people think that this type of surgery would leave the leg all loose and dangling, but animals are such incredible creatures, and what happens is that the muscles will take over the support of the joint. And a young nimble cat like Colin, well, look, he will soon be walking again just fine. Hey, it's done. Right, let's wake little Colin up, shall we?
While Colin slowly comes out of the anaesthetic, Scott checks X-rays on his handiwork.
It looks pretty good. This is a normal hip joint, so a ball and socket joint. And so it rolls in there, and then you've got all the musculature that moves it around. In this case, we no longer have a joint, but the muscles are still all attached to all the same places, so they'll still move the leg in the same way. So therefore, he can run around perfectly fine. Such a sweet boy.
You good boy. You getting ready to see Auntie Audrey? Yeah.
In Sydney, Audrey's first patient is Rottweiler Bear. Nurse Bree has just collected him from his owner.
See? Hi, Bear. Look, Bear. Look, it's Auntie Audrey. Are you wearing the musky tie? Oh, I'm so worried, my boy.
Audrey's known the gentle giant since he was a pup.
Bear is huge. He's probably tripled in size since the last time I saw him. It's hard to believe that he's only 18 months old. So Dad's really worried about him?
Yeah, he's found a lump and he's quite concerned about it. Obviously, he's a young baby. He's still a bit of a puppy brain.
Yeah, where is it?
It's on his ear and it's just grown quite significantly. What was so worrying is that it's gone from bobby pin size to that in about a month.
Oh, buddy. That looks massive and looks quite sore. So I think probably the best thing is we take him back to the hospital, shave that up, have a really good look at it, see if we test it or we take it off. Usually we don't worry too much about lumps in a young dog. They tend not to be nasty, but with this particular lump, I am actually concerned. I'm baffled as to why it's growing so quickly, so I'm worried it could be something like a tumour.
1, 2, 3, quick.
Good boy.
So lumps and bumps in dogs, especially tumours or nasty tumours, can be concerning because they can spread internally, they can spread across the skin, and ultimately, if it does spread to an internal organ, it can cause death.
You ready?
Good boy. All right, let's have a look at this ear. I'm just going to turn him around.
All right, let's turn around.
I know, it's sore, I'll be gentle. So it's huge. It's grown from just a couple of weeks, but it's only on the surface. It's actually not to the underside, so that's good.
No, that's really good. But I just can't believe how, like, quickly it's grown.
I know, buddy, it's sore. I know, buddy, it's
you
sore.
don't like it.
I'm concerned that it's causing him so much pain. He really doesn't like me touching it. It's hard, it's rounded, and it looks pretty sore because it's all ulcerated on the outside. Good boy. What's a funny noise?
Oh, that's weird.
Oh, that tickles. Even though Bear is a big, gentle giant, when he's in pain or when he's scared, he can start growling and potentially snap. So I'm just going really slowly with him, and hopefully he won't even notice that we're taking bloods in him today. Oh, that's the foot I need. All right, scratch yourself. It's fine.
Oh my.
It's on my head.
Oh my God. All right, second shower of the day. Thank you.
You're right. Good girl. On the Gold Coast, Gerardo and his team are prepping Border Collie Storm for an emergency caesarean.
We're against the clock. One of Storm's puppies' heart rate is dangerously low. If we don't go to surgery, that puppy may die.
Okay, here we go.
That's okay, Storm.
You got the best team here.
Okay. Yep, okay, I'm on my way.
Gerardo needs all hands on deck.
Time to rally the troops.
So Alex will be in charge of the resuscitation team to help any puppies in distress.
Do you know where the resuscitator for the puppies is? Any birth is an anxious time, and right now we know that Storm can't deliver her babies naturally. This is where we all step in and hope there's a good outcome.
We're gonna do a test cut. You ready?
Storm's uterus is really big because of those 8 puppies. We need to get her puppies out now.
So one pup here. We've got the head now. See the head? Okay, gently pull on the head, and I'm gonna gently pull. What we're gonna do is gently hold on, and see the placenta here?
This is where the adrenaline really kicks in. Gerardo has just delivered the first puppy, and fingers crossed it's alive.
Got it? Go.
Alex and her team are now ready to swing into action.
Oh, he's a pretty colour.
I know, it is.
It might look a bit rough, but this is how we resuscitate puppies. By rubbing them with a warm towel, it helps them to start breathing and clears the fluid from their lungs.
Hey, little guy, you're so pretty.
3 more puppies have now been delivered, and Alex and her team are desperately trying to keep them alive.
Any of them squeaked yet? No. No.
Silence is not what we want right now. We're all on edge until we hear even the faintest squeak from these puppies. It means they're alive and breathing and going to be okay.
Come on, little one. Come on. I'm waiting for those big little cries.
Hey, Rosie. We're not doing Rosie first, are we?
We're saying good morning to all the koalas.
At the Australian Reptile Park Koala Enclosure on the New South Wales Central Coast, it's a big day for Tim and his team.
Koalas are up against it. We've got habitat destruction, urban sprawl. We've then got catastrophic things like bushfires. So many koalas lost their lives. But then there's one greater thing again, and that is disease.
One disease in particular can have deadly effects on the park's koala numbers.
Corv B is a koala retrovirus that is just ravaging the population. Now, we're going to test everyone for Corv?
Everyone except for mums with joeys in the pouch.
OK.
Blood samples will have to be taken from all the koalas, but the process isn't going to be easy.
Hey, good morning.
And this is Rupert.
Hey, Rupert. We're going to start with probably the most sensitive koalas, the females carrying large joeys.
All right, little baby. So I'll let you take him off, Tim, and I'll hold the toy.
Little Rupert, come on, mate.
A cuddle toy will keep little Rupert happy, while Vet Robin takes a sample from Mum Rosie.
It's OK, Rupert. It's OK, Rosie. It's OK. She's being great. OK. Just tie that. Robin can come in now and find the vein. Don't look. Well done, Rose. The worst case scenario today is that our population is full of Corv B positive koalas. B is the nasty one. B tends to come with death. So what we don't want to see is Corv B. That's it.
Good boy. That's a funny noise.
In Sydney, huge Rottweiler Bear isn't exactly being cooperative, as Audrey prepares him for surgery to check a worrying lump.
Bear's a little bit hesitant with the sound of the clippers, so I'm trying to make it all a bit of a game.
All right, now there's going to be a little mozzie bite. All right, good boy. You didn't even feel it.
In the end, I don't think he even notices the needle going in, so great job to everyone.
There we are.
Bear's blood results are clear. Audrey can now go ahead with his general anaesthetic
Good night, Big Bear.
so she can get a closer look at his ear.
Hey Buzz, did you want to help us lift him onto the table? He's heavy, so be careful. All right, this is going to take a lot of teamwork.
Getting Bear onto the table is a big task.
3, 2, 1.
So we've got our work cut out for us.
Okay, 1, 2, 3. Okay. Okay, thanks, Buzz. Thank you.
Wow, it's quite big. Every lump is different, and I just don't know how well attached it is to the underlying structures. So I think we need to go in and remove this lump, because if we leave it any longer, we may not be able to remove it at all, or it might be something nasty.
So it doesn't come through to the other side, which is good, but it certainly feels, from how it feels right now, attached to the cartilage. Like if that's the whole ear, that's how big that is. If it's attached to the cartilage, we have to remove some of the cartilage. So his ear is going to change shape slightly and it's going to bleed a lot more. Whereas if it was just attached to the skin, that would be a lot easier. Oh, that's going to be hard to close. That's just made it a bit more difficult. Not impossible, but difficult.
And who's going to restrain Miss Rosie?
I will. There you go. It's OK, Rupert. It's OK, Rosie. It's okay.
Okay, sweetheart.
She's been great.
Good girl.
I'm just going to let her wander off, okay?
Yep, she can go.
Here you go, Rose.
At the Australian Reptile Park, Tim needs to find out if any of the koalas are carrying the deadly Corv B virus. Blood samples need to be taken from all the mature koalas.
It's time for Penny. And Penny also has a little Joey. But in this case, we don't know whether it's a little boy or a little girl. It's the first time we will have had interaction with it. So that's really exciting. What do we have there, little boy or girl?
Oh, are you ready to reveal?
Yeah. Penny's Joey, a little boy.
Little boy.
And that's great. If you're wondering how we can tell it's a boy so quickly, just have a look at the peanuts.
Little tiny peanuts. Teeny tiny.
Almost done. Got it. Okay.
Fantastic.
Penny's done, and it's time for the little fella, our little boy, to be reunited with Mum.
Hey, there's Mama.
Okay.
Thank you.
Off you go. We've finished the mums with big Joeys, and now it's time for the teenagers. And they're not going to be easy.
Come on, Cheeky. Oops.
Good lad. Come on, little one. Come on. How you guys going?
On the Gold Coast, Alex and a full team of nurses are working frantically to save a litter of puppies.
Come on, little guy. Yeah, just what I'm pretty worried about. It's just no response at all. Our hearts are in our mouths. Any second now, we're desperate to hear the telltale squeaks that tell us that these puppies are alive. I think it was a good move to get in there and get them out driving.
Okay.
Yeah. This is his last one. Yeah, he's pretty weak.
Yeah, they keep going and coming and going and coming.
How you doing, buddy? All right, you can go meet your siblings, hey?
Oh, that sound is so incredible. A newborn puppy's cry is so precious. We never get tired of it, and importantly, it tells us these puppies are going to be okay, and that's a huge relief.
Last one coming through.
Oh.
Good catch.
Last one.
The lively puppies are going straight into an incubator to help keep their tiny bodies warm and provide them with extra oxygen. It will be a while before Storm can meet her 2 girls and 6 boys.
But the safest thing for her now is to get out of surgery quick.
That's how big that is. Oh, that's going to be hard to close. That's just made it a bit more difficult.
In Sydney, Audrey is shocked at just how big the lump is on Rottweiler Bear's ear. The lump has grown rapidly over the past few weeks, and Audrey's worried it could be something nasty, like a malignant tumour.
I'm just trying to see if I can get it off the cartilage, if it really is attached. All right, I'm taking it out.
You good? Yeah, okay. Now that the lump is out of the ear, we pop it in a special jar and we send it off to the lab where they're going to section it and try and find out exactly what type of lump it is and how nasty it is.
Looks like I'm going to have to take out that much cartilage just to close it. Looks like we're removing some cartilage anyway. So this guy is going to need lots of pain relief.
Good as new. Hey, baby.
I think the operation has gone very well, and moment of truth is to see how that ear looks now with a big chunk gone.
Wow. Everything closes together. I'm really happy with how the wound looks. I think the ear is going to look like an ear at the end of this, and we're going to have taken every nasty cell out of his body. Fingers crossed.
Once the hair grows back, you'll never even know.
Now it's time for the teenagers, and they're not going to be easy.
At the Australian Reptile Park,
And of course, they're right up in the tops.
Oh.
Tim is trying to test the koalas for the deadly corv-B virus. But the cheeky teenage koalas need a bit of gentle persuasion.
No, not higher. You're meant to come down, not up.
Come on.
Hayley's got a little pole here. What the pole does is koalas obviously don't like things like birds of prey, eagles above them. So we put the pole up just above the koala, and it actually makes the koala come down so that we can grab them.
Oh, now she's having a scratch.
You didn't happen to hand raise this one too, did you, Hayley?
Oh, no.
Oh, look at her.
Come on, cheeky. Oops, come down.
Come on.
There we go. Come on.
A little bit more. Well, that wasn't easy. That wasn't. No, come on. Almost. Come on. 1, 2, got you. Hey.
Except these don't like to play nice.
No.
While it might be fun trying to get the koalas down, the reason behind it is deadly serious.
If we identify B, we have to stop breeding those koalas. We've worked so hard over 2 decades to have a robust population of koalas. If it turns out that for the last 2 decades I've worked with this population and they're riddled with corv-B, it was all for nothing.
Good.
Thank you, sir.
Good girl. Now we just feel her.
All done. All done.
Now Tim faces a nervous wait.
For us to get results back that were, let's say, all Bs, that would just be catastrophic.
Hey, David, how you doing?
Hi, Scott. You okay?
Yes, very well.
In Isleworth, it's been an anxious wait for worried owner Dave, while Scott performed major surgery on his precious 6-month-old kitten.
From a completely healthy cat to having a major orthopaedic surgery, it's a bit of a shock.
Yeah.
But you know what? We've sorted it. So come on in. Here's your guy. Look, he's here. You okay? Oh, he loves you. You can tell.
He's so cute. You know, everything's on his terms. When he wants love, he just basically jumps all over me. When he doesn't, he does his own thing. But I can't really imagine not having him now. He's a really sweet boy.
My hope for Colin is that he will respond really well to this surgery. He'll have to begin to use that leg, but he'll learn to use it in a really different way. But he is a young cat, so hopefully he'll just bounce back and soon be bounding around the streets of Isleworth again once more.
She's fine, she's recovering from anaesthetic. And you have 8 beautiful little puppies.
On the Gold Coast, new mum Storm has fully recovered from her emergency caesarean and has finally been united with her 8 precious babies. The 2 girls and 6 boys are making the most of a very sleepy Storm, enjoying their first big drink of mother's milk. Proud owner Jessica is beside herself with emotion.
Oh, that's so wonderful. That's amazing. I honestly could not be happier with the outcome. I am so thankful. We didn't lose one puppy and Storm is doing well. I just couldn't hope for a better outcome. I'm so happy.
Oh, there we go. She's like, oh my God. We can actually bend this backwards.
Hi, okay.
Yep.
Hi, baby. Hi. Hey.
Today is actually Storm's birthday. She's 2 today, and so now she gets to share her birthday with her 8 beautiful little babies. Oh, how can you not be happy when you're holding a puppy?
I know.
Hey Jackie, what have we got here?
This cutie pie is Tilly.
Tilly?
Now, Tilly's
Tilly.
mum and dad have brought her in. They've just noticed that she's been urinating more frequently.
Okay.
On the Gold Coast, Alex is about to treat young cattle dog Tilly. Her owners Brian and Susan were anxious when the 4-month-old tried to go to the toilet 6 times in 5 minutes.
It wasn't really evident that she was passing anything, so yeah, that's what worried us.
Seeing Tilly trying to go to the toilet that often was distressing. I became immediately concerned for her if she was in pain.
The empty nesters have only had Tilly for a few weeks, but have already fallen deeply in love.
And she's just absolutely loving and adorable.
Dear, sweet little girl.
And you know when you look into that pet's eyes that...
She just means the world to us.
And there's total unconditional love.
Just want to have a bit of a feel of her bladder. Good girl. She's just uncomfortable when I feel around that bladder. It's tiny, so that fits with something like a urinary tract infection, where her bladder's not actually full, but she feels the urge to go all the time.
Before running tests to see if Tilly does have an infection, Alex checks her vital signs to make sure everything else is okay.
Yeah, little heart's racing, she's just nervous, hey? Let's see if she's running a fever.
See what your temperature is.
Look at those ears though, they're just adorable. She's just listening to everything. Yeah, temperature's normal, so that's good, so there's no fever. But I wouldn't mind giving her some pain relief, actually, because she's definitely uncomfortable. With a UTI, it really can be quite painful. So first thing we want to do for her is just to get her comfortable. A little scratch, darling. Good girl.
See there, good girl.
Oh, that sting, like a bee sting. Hey?
With Tilly's pain under control, Alex will now do a urine test to see if any infection could be causing the young pup's frequent trips to the toilet.
Probably going to need to get a urine sample from her bladder. I know at the moment it feels tiny.
Alex needs to perform an ultrasound so she can extract a urine sample, but she's concerned because Tilly's bladder is so small.
So we've got the bladder here. We should be able to get a sample from that. You right, Tiff?
Yep.
Okay, here we go.
Good girl, brave girl.
That's it. That's good, perfect.
I love this dog. Oh, you are very beautiful. Good girl.
Once the hair grows back, you'll never even know.
Back in Sydney, Audrey has finally managed to remove a large lump from Rottweiler Bear's ear. It will now be sent off for analysis. Audrey's hoping it's not a cancerous tumour.
Do you want it to wrap around the whole ear?
Just like that. And we'll pass it to me. Yep, stick it on that surface. Just keep the shape of the ear as much as you can.
The operation's gone really, really well, so all we need to do now is bring him into recovery.
Are you all right, Audrey?
I am. And from there, we're going to watch him recover and pull the anaesthetic tube out once he starts swallowing.
All right, Bear, you did well. We got the lumpy out. You want to wake up and go home and see Mum and Dad?
2 hours later, it's time for Bear to be taken back home to his family.
Let's get
We're
you
very
back
sleepy.
to Daddy.
All right, come on,
Let's
baby.
go around this way. Yeah, that's a good boy. You good? Yeah, let's do it.
Hold on, wait. Oh, my brave boy.
Baby,
are you okay? You ready? You want me to help?
All right.
I'm not sure
No,
I can
you're
help.
going to need my help.
Ready?
Let's go, Bear.
Hello. Okay, 1, 2, 3. Ah! Bear, you're going to have to help a little bit.
Wow, I've never had this happen before.
Okay.
Oh, good boy!
Oh, great. Just as I was about to help you.
Good boy.
And sit your bottom down
there. And relax.
Oh, my God.
And relax.
Are you going to have a sleep on the way home?
Yes. That's hysterical.
Good night.
Let's go.
Let's go.
That's it. At the Australian Reptile Park, where Tim tested all the koalas for a deadly virus, the results are finally in.
Hit me with it. Is it good or bad?
Mostly good.
Yeah.
A couple are bad. So out of the 30-odd that we tested, only 2 have B.
Yeah, it's
been a long week.
Well, I mean, that's mixed because that's not good for those two individuals. But for our population...
For our population as a
that's
whole?
Fantastic.
Great.
That is a massive weight off the shoulders. It's mixed feelings for the two koalas that have called B. Nothing changes for them. They just won't breed. This is a really good result. We can implement management actions further to what we're already doing to improve our koala population. That's not where our ambitions end. I mean, there's a collective of like-minded people trying to save the koala from extinction in the wild, and every bit of useful information we have contributes a little bit more towards helping the species.
So we've got the bladder here. We should be able to get a sample from that. You right, Tiff?
Yep.
Okay, here we go.
Good girl, brave girl.
On the Gold Coast, Alex is trying to find out why young cattle dog Tilly is having severe difficulty trying to wee.
That's it. That's good. Perfect.
She's hoping she can locate Tilly's bladder using an ultrasound so she can get a urine sample to test for infection.
That's it. Nice and still.
Hey, good girl.
Okay. Yeah, that's good. All right, we've got urine.
Good, brave girl, Tilly. Oh, you are very beautiful. Good girl.
I reckon you've got a soft spot for cattle dogs.
Maybe your secret's off. I like this one. I like you.
Yes, because you're super cute.
I think that pain relief's helped her a lot.
Yeah, I did too. Also just want to see there's no abnormalities there, no stones in her bladder. No, it looks nice and clear, which is good. Bladder wall looks normal thickness.
The scan results are good news. But as Alex and Tiffany return their patient to the kennel,
Get on the floor.
they find there might have been an easier way to get their sample.
That's all right there. Looking at the concentration of the urine, it's actually very dilute.
Alex runs a series of tests on the urine she collected.
It does look like there might be a small amount of inflammatory cells in there, which could point to infection, and also some red blood cells as well. So those two things are supportive of infection.
To get a clearer picture, Alex puts Tilly's urine under the microscope.
So we're going to look at the urine a couple of different ways. One will look to see if there's any inflammatory cells or bacteria, and the other one will look to see if there's any crystals. So this is just the first slide that's just looking for any crystals. I couldn't see any bladder stones on the ultrasound, but sometimes you can have tiny crystals that will only show up under the microscope. Yeah, that looks pretty clear, which is good. So nothing too exciting on that one.
The second slide should confirm if Tilly has an infection.
From what I've seen so far on the dipstick and also the signs Tilly's showing, that's what I'm expecting to see. She's got inflammatory cells and some bacteria. That shows us there's an active process going on, so she has a urinary tract infection. At the moment, it's not crazy bad. Tilly's owners have been really onto this and got her in quickly, but if they hadn't brought her in today, she would have been in a lot of trouble because urinary tract infections can often start off quite mild and really get nasty very quickly. So we can start her on antibiotics.
Alex hopes tempting Tilly with some tasty treats will distract her while they give the 4-month-old another needle.
Come on, sweetheart. You coming out? Oh, you can smell it, can't you? Can you smell on my hands? Good girl. Come here. All right, you ready? I'll give the treats and you give the injection.
Okay.
Okay.
Let's see if this works. You ready?
Tilly. Yummy. They love this. These are the new kangaroo treats. And I bet you, if we give her the injection at the same time, she won't even notice it.
Seriously?
They all love it. Good girl. Yummy.
She didn't even notice.
She's like, where's the rest? Oh my God, she's such a good dog.
The next treat for Tilly is being reunited with her loving owners, Brian and Susan.
Oh, she was so good. Hey. Yeah, it's okay.
Sweetheart. Oh, come up here. Oh,
good girl. Isn't she beautiful? She's had that pain relief today, so she's a little bit sleepy.
I can sense that, a little bit sleepy.
Hey, but she just needs lots of cuddles and she'll be fine.
Get that.
Once the antibiotics kick in, she's going to feel a lot better. I'm not too concerned about this. I think it's probably a mild infection will bring under control pretty quickly, so she doesn't really need an ongoing plan. But if she had a recurrent infection within a short period of time, then we would become more concerned. Thanks, guys. She was just, honestly, she was an angel, an absolute star.
She's an immense new part of our world. We love her dearly and see a beautiful future with her.
All right, you take care.
Appreciate that, you too.
The future looks fantastic.
3 weeks later, little Colin is making good progress after Scott repaired his shattered leg.
It's a good boy.
And Audrey's big, gentle patient Bear has also recovered well after he underwent lump removal surgery.
Here he is. Come on, Bear.
Hello, Bear.
Today, Audrey's paying a home visit to Bear's devoted owner, Matt, to deliver the test results.
We have got the results back from the lab. So it did come back as a lump and it was a tumour, but it's a benign tumour.
Okay, that's great news.
Yeah, very good news. We'll see you later, Bear. Behave, okay?
Bye. See you, Audrey.
Bye, Bear. Bye, cutie.
Do you want to invite all your friends? You do? Okay. Okay, well, we'll invite all of your friends.
In Sydney, it's a bittersweet day for Kate and her much-loved golden retriever, Benny.
How do you feel about getting a cake? You do want a cake? Oh, look at this cake.
Benny is about to turn 15, but a major health issue is overshadowing plans for his milestone day.
Benny has regular ultrasounds, and 3 months ago now, I noticed that he had a very small nodule on his spleen. You're a good boy. If it's growing, whether that be benign or malignant, it's starting to pose a risk. They will rupture, and Benny will end up dead. You've got to be here for your birthday, you realise.
Kate has booked a CT scan to see if Benny needs surgery on the dangerous tumour. She's all too aware of the risks for her precious old boy.
I've had Benny since he was really little. He was probably about 3 days old when I first met him, and I instantly knew that he was the one that I wanted. Since then, we've been inseparable. He's a part of me. To be honest with you, Benny isn't really a dog. He's his own little person. You good? So good.
Although Kate's extremely nervous about what the scan will reveal, she's trying to stay optimistic, and planning Benny's birthday is the perfect distraction.
I really wanted to have a birthday party for him this year. 15th birthday for Benny, so we've got like festoon lighting, bartenders, waiters, we've got chefs, the whole bit. What about this cake? Or do you want to do this one? When it comes to Benny's health, I'm the best bet there is. Benny is insured. He's been insured since he was 8 weeks. I'm an advocate for pet insurance. I have done absolutely everything within my power to save this dog. Oh my goodness, this is the cake. This is the way I want it. What have you been doing with your life? 15 is a really good innings, and every single Christmas, I always think this is going to be Benny's last. And I keep thinking, how lucky am I?
Benny survived cancer 5 years ago. Kate's desperately hoping her brave old boy is still strong enough to weather this latest health battle.
He's going to leave me at some point. And, you know, his euthanasia has rolled around in my head a million times. You just keep loving them until it's their time to go. But he still wants to live. He still tells me every day of his life, he wakes up, he says, no, I still want to live.
Benny's scan is now just hours away, and it's the birthday boy himself who's giving Kate the strength to face the outcome.
Reg, come on.
In the UK, at Scott's Isleworth practice,
Hi Stacey, how are you?
I'm all right, how are you?
I'm good.
Stacey has arrived with her 18-month-old Jack Russell cross, Reggie.
Hello, nervous boy. Wow, he's really limping on that leg at the moment, isn't he?
Yeah. Come on, Reg.
Come on then, big fella. Come on then. Good boy. That's it. Good boy.
He's such a lovely dog. Very friendly. I absolutely love that dog. I love that dog to bits. Do you know what? It's so weird. He just jumped, ran off into the kitchen, leg up, wouldn't let us touch him, and then all this aggravation.
Well, let's have a little look at the leg itself, shall we? If you just hold him around the shoulders there, so we can just see he's just immediately not wanting to put weight on that leg. But what he has is wobbly legs. So the cruciate ligament, which runs through the knee here, basically the two parts of the leg is like that. The cruciate runs through the middle.
Yeah.
And I've got movement like that. When examining Reggie's knee, it's really clear that he's torn his cruciate ligament, which is a very important ligament in the knee.
But it's not just Reggie's knee that Scott's concerned about.
He's a little bit on the heavy side, Stacey, isn't he?
Yeah, that's all the treats. KFC.
KFC.
Egg and bacon rolls.
Right, so the way you said it would suggest that you know that's not a good idea.
Yeah.
So we do need to sort of stop that, because when you have got a dog that's bouncing around, jumping off things, possibly skidding out, and then carrying that little bit of extra weight, just a little bit, then unfortunately you can see that snap occur. So today what we need to do is to sedate him, then we'll likely move forward with surgery. If the surgery wasn't done, then what happens is that all that instability leads to a very weakened leg, a leg that he won't use. You lose a whole bunch of muscle, and when it finally does stabilise, it can stabilise in a very strange way, and it can mean that the leg is completely unusable. Sadly, if this goes untreated, in worst case scenarios, some dogs need amputation. And so today, obviously, there is a risk with the anaesthetic.
Yeah.
So how are you feeling about that?
Bloody nervous. I can talk to Reg. If I'm feeling sad, he knows, and he'll come and sit on my lap. Even though there's been times I could strangle him when he's ripped up the flat. I absolutely love that dog. I really love that dog.
Say goodbye to Mummy, Reg. Good boy.
Be good. All right? Bye, Reg. If anything happened to him today, I'd be bloody heartbroken.
It's okay, I know.
Just want to sit down there? There we go. Good job.
In Sydney, Kate has brought elderly Benny to the small animal specialist hospital Sash for a CT scan on his spleen after an ultrasound revealed a possible cancerous mass growing on it.
Hi. Hi, I'm Stella. Nice to meet you.
How are you?
Hi, Benny. Hi, handsome. Shall we go and see what's going on?
Cancer specialist Dr. Speller will conduct the scan to check if the worrying mass is getting bigger.
I'm nervous.
I know.
Oh, I'm really, really nervous. I felt like getting him and just running out the door. He's got his 15th birthday party in a month, so I thought, oh my gosh, Benny, like nothing bad can happen today. You're a good boy.
Perfect. So nothing concerning on your exam, which is great.
After passing an initial health check and subsequent blood tests, 14-year-old Benny is cleared to undergo the CT scan.
3, 2, 3.
What I don't want for him is there to be this giant splenic tumour in there, and that it's going to bust in the middle of the night and I'm going to end up at emergency department and he's going to end up having to be euthanized on the table. Like, I don't want that for him. I want him to have a dignified death and I want him to have a good life. What do you see?
Yeah, so it looks like the lesion has grown.
It's not 2 centimetres.
The tumour has almost doubled in size since Kate discovered it 3 months ago.
My heart just sinks because I just know there it is. That's what I've been looking for. This is going to be a mega problem. It still poses a risk to his life.
Yeah, that can potentially rupture.
That still can rupture. He still can bleed out. It's a non-essential organ, so if he's got a better chance of survival by removing the whole spleen, then that's what we're doing.
Hi.
Yeah.
That was a bit rough, wasn't it? So tired for an old boy.
But given Benny's advanced age, Kate knows surgery to remove the spleen could also be life-threatening.
Stupid tumours. I hate them. Like, I just wish that they could live forever. And I just, I know he's really old, but I just am never ready to lose him.
You're a good boy. And it's your birthday soon. You've got to come to your party.
Is there Toey?
At the Australian Reptile Park, there's movement at the swamp, and the alligators are sensing that something's up.
Over to temp.
Go ahead, mate.
Hey, mate. Looks like we've got a tree down on the ramp on the alligator lagoon that's going to need removing, and probably have to have a really good look at the ramp itself as well.
Yeah, see you soon. Fallen trees are a pain in my butt. But when I hear that one's fallen on the gator ramp, which is a pretty important bit of structure, right? We feed the gators off it. If the ramp gives way, that's us in the water. So sounds like we've got to get rid of a tree and have a look at our ramp. When did that come down?
Not sure. Must have come down last night sometime.
Yeah, and it's on the ramp.
Yeah.
The gators aren't minding it.
No, not at all.
Paper, scissors, rock for who's moving the gators. Ha! Yes! Got a couple of sticks?
Yeah, mate.
Yeah, nice. It's the time of year when the gators are still sunning themselves. You know, it's warming up and they're really soaking that in. There's a couple sitting on the ramp right where the tree's fallen.
Yeah, do you want to do rock, scissors, paper again?
Nah, you're up, mate. Cheers. Come on. So first thing is to move those gators. Come on, girls. But they are not to be underestimated. Off you go. Off you go.
Come on, big girl. Come on.
I know you don't want to go in, but you have to.
Into the water.
Off you go. Wrong place, wrong time. Come on, you.
All that instability leads to a very weakened leg, and it can mean that the leg is completely unusable.
At Scott's clinic in the UK, 18-month-old Reggie is about to undergo knee surgery.
So Reggie's in today for what is very likely to be a cruciate ligament rupture. So that's a very large and important ligament in the knee. It controls movement between the top and the bottom of the leg in the forward direction, which then means that the knee is unstable, and in the case of dogs, they then lift their leg right up. So in Reg's case, if nothing was done with his knee, a lot of the musculature of the leg, which relies on him using his legs, will wither away, and in some cases, we have complete disuse, and sadly the leg will need to be amputated. All right, buddy. It's really important in Reggie's case that we perform x-rays to make sure that we fully understand the problem. So it is just a case of that ligament running through the knee here, so we need to go in and fix it. All right. There's many different ways to correct a cruciate ligament rupture in dogs, but the one that I'm going to perform on Reggie is called a lateral suture. It's basically placing a false suture to mimic the stresses and the strains of the joint that's taken on by the cruciate ligament before it's ruptured. All right, Reggie, I'm going in.
You ready? Come on, this way, let's go this way. Good job.
In Sydney, Kate and 14-year-old Benny have arrived for surgery to remove his spleen, which has a life-threatening tumour growing on it.
But I had this moment last night when I thought, if I get in there and he's just got tumours everywhere and he's covered in cancer, what am I actually going to do about that? Am I going to be able to put him through, ethically, this surgery in a really old dog to give him, say, extra 2 months? And I think the answer is no. Hi, Dr. Eugene.
Hello, Dr.
How
Kate.
are you?
Lovely to see you again. Hello, Benny. Hello, my sweetie. How you going?
Kate has asked specialist surgeon Dr. Eugene Buffer, who has operated on Benny before, to conduct the surgery.
It's a nerve-wracking day, Eugene.
I can imagine. He's
getting old.
Yeah, and he's very special.
Very special.
Yeah. The spleen is the blood storage organ, and when they develop masses or lesions, there's always a danger that that mass can rupture, and if it ruptures, it can be fatal. So that's the reason for our decision to proceed with surgery. Nice, strong heart. Okay, so what we basically here for today is removing the spleen.
Kate is asked to be present during surgery in case life and death decisions about her beloved Benny need to be made.
My feeling on this, Eugene, is let's just say we kind of get in there and go, oh my goodness.
Yeah.
I mean, I don't think that's going to happen, but
Yeah.
let's just say that does, right? I'm going to put him down. You know, it's about him.
Yeah, that's right. We don't want him to suffer.
Yeah.
I promise you honesty, and if I think that this dog is not going to do well post-operatively, I will tell you.
Yeah.
I'll treat him as though he's my dog.
Yeah.
Kate requests 2 minutes alone with her beloved companion Benny before the surgery.
Thanks, Eugene.
Love your mum, don't you? Love your mum. You're gonna be okay, okay? You be tough.
This isn't the end. Coming here, I thought, oh my gosh, this could be the last time I see him. I know that this love affair is going to be over at some point. It's just always hard to say goodbye. I love you.
Ah, not food. I know you don't want to go in, but you have to. Wrong place, wrong time.
At the Australian Reptile Park, Tim and Obi are trying to fend off massive alligators so they can assess a large tree that's come down across a feeding ramp.
I know you're sunbaking and you don't want to, mate, but off you go, please. Come on.
Round to the water. Up. Come on. Keep going.
There's 3 on the ramparts.
I think you're going to take this job, aren't you?
No, I got my own.
Come on.
Well done. Go on, off you go.
All right, you 3. Time to get off.
Come on, you lot.
Come on.
Come on, off you go. Mate, they're like dinosaurs today.
Come on.
Come on. That's 1. The tree obviously has to go, but it's hit the ramp. And what we need to assess is if it's done any damage, because that ramp is critical. We feed the gators from it. If it collapsed, our staff fall in the water to 40 alligators.
Come on. Come on.
Come on, mate. Off you go. Well, come behind us here. Obes wants food.
Hey.
You watch that one?
Right.
Come on. Off you go. Off you go. Well done. Well, this hasn't hit too hard, but enough to take a bit of bark off.
Yeah, definitely.
And the tree's got to go. Righto.
Get the chainsaws, eh?
I think so. Maybe you want to get a bit of gear and I'll rally the troops?
Yeah, no worries.
A job like this, where we've got 40 gators around us, it's easy just to get a team in, cut it up, a couple of eyes on the gators, get the tree out. It's a nice, quick process.
It might be quick, but with deadly spectators, every minute counts.
Oh, there's a bit of weight to it. Obi, a couple behind you.
The tree's gone, and we're looking at the ramp. The timber has been hit and broken, but pretty superficial. I'm far more worried about what's under the timber, the structure of the ramp.
I think it's timely just to have a bit of a look at the supports anyway.
Yeah, I would like to before we start feeding.
Yeah, I bet you would.
I think the easiest thing now is to go and get the boat, paddle out, and try and see if we can get a bit more of an idea of what's happening under the water. The big fella's next to it.
Dan, he's yours.
He's yours, Dan. Dan, over to myself, walk around and collect the boat. And we've got this gigantic male gator just sitting right there.
Come on, big fella.
Dan attracting the girls.
Oh, look at him. Woo. Do you want to just give him a tap with that and I'll get his tail?
Come on, big fella.
Ready? 1, 2, 3. Again.
That's it.
1, 2, 3.
This gator would weigh somewhere between 200 and 300 kilos. He is a big boy. He wouldn't budge.
Watch out for him to swing. Nah.
Come on. Come on.
Ready?
Wait.
Well, that's not working, mate.
All right, Reggie, I'm going in.
At his UK practice, Scott has started surgery to correct the torn ligament in Jack Russell Cross Reggie's knee.
So what I'm doing here in Reggie is placing a false suture. So it's not like you replace the cruciate ligament. Instead, we replace the tension that the cruciate ligament applies upon the stifle, the knee joint. Okay. So what I do is place a bit of suture material, like the kind of nylon that you catch a shark with, and it basically goes behind the fibula, which are in the back of the knee. We then drill a hole through the tibial crest, which is the bottom part of the knee. Drill a hole through there, the suture goes through there. Then the suture comes up underneath the patellar ligament and then gets crimped, basically squeezed together with a little bit of metal. Okay, great. And that then drives the top and the bottom of the knee together, and by doing so, stabilizes the joint. So I would hope that this procedure will mean that Reg can make a full recovery. I'm really happy with the surgical result here. And please. And done. And he should bounce back. It's nice and solid. And hopefully he'll be skipping around the streets of Isworth very soon.
Reggie will sleep off his anaesthetic before going home.
It's okay, it's all right, come on. Good boy. All right.
Watch out for him to swing. Nah.
At the Australian Reptile Park, Tim and his team are venturing into deadly alligator territory to try to get a closer look at a damaged ramp.
Come on, big fella.
Ready?
Just watch him turning.
Watch him. Well, that's not working, mate. Let's just get the boat.
Walk around him. You can stay.
Hold on, we're on that shelf. Hey! Oh, did we put the bung in?
Yeah, bung's in.
Bung's in.
Venturing onto the water is risky, but it's the only way Tim will be able to get a closer look at the damaged feeding ramp.
When you're in a boat in the middle of a swamp and there's 40 alligators, you need to have your wits about you because gators still have one of the strongest jaw pressures on Earth.
Oh. Well, watch this big fella, mate.
If your hand goes in or your body goes in, don't worry about just the damage from the bite, but they're going to hold on and take you to the water and try and take you under.
Did we just go over a gator?
This ramp is a life support system. Now we got Ranger Mick and the team out there feeding these gators from the ramp. If the ramp goes, they go. And where they go is not a good place to end up.
With the paddle, I'm just feeling the edge of the post. What we want to know is the integrity of the post underwater where we can't see. I really can't feel much with the paddle or see anything because the water's like coffee. But the first thing that you want to do is put your hands in and have a feel, and we can't do that, but we need to.
I think the only choice is to get in the water. I don't like getting in that water, but what I would like even less is for someone to fall off the end of that gator ramp while they're feeding 40 gators. So there's a balanced risk there, and the best thing to do is me to jump in and have a look.
Brendo, you know where the fence panels are?
We don't just have a gator cage lying around. This is a unique job. So I've asked the team to go and grab some fence panels. You know, about the right size, about the right height. They should do the job to be able to create a cage.
You got him, Bren? Righto, next panel. Anyone got a tiny bit of rope, cable tie, something like that? Oh, you're a beauty. We work with animals. That doesn't mean we're good mechanics. Jesus, mate, we're about to go in. I don't feel comfortable. We don't know what the gator's going to do, so please, eyes and ears out. Someone look on that side, someone at the end, someone this side. And if there's a gator, no practice runs, only real deal. If there's a gator, sing out.
We've probed around with the paddles, you know, we're pretty comfortable, but that's no guarantee that a gator's not going to be sitting on the bottom.
So let's get this over with.
I've got 2 protectors on the water and I've got 3 spotters on the ramp. I just want to get in and get out.
Good luck.
They're right there.
Good luck, mate.
See you later.
A few bubbles to your right.
Bit cold, mate?
Cold? Tim, don't move, mate. Stop moving.
Suddenly, Tim's ramp inspection has turned deadly, with massive gators moving in to check out the intruder.
It's only a couple of metres. Oh, yep, got him. He's coming. Yep. Come on.
You're gonna be okay, okay? You be tough.
This isn't the end.
In Sydney, Kate is about to join Dr. Eugene in surgery as he operates to remove a tumour-diseased spleen from her much-loved golden retriever, Benny.
Everybody ready? Nice bold incision.
The reason that I want to be in there today, it's actually because if I see in that abdomen and it's a disaster in there, then he's not going to be waking up from surgery today. I'm going to put him to sleep on the table.
Okay, into the abdomen. We'll just go forward and backwards now.
As well as the tumour on his spleen, Kate is worried they might find cancer in other parts of Benny's body.
What's that on there?
Could be sort of a granulomatous reaction where it's touching the liver.
Yeah, right.
The kidney looks fine, and his gallbladder, that feels okay.
Yeah.
Thankfully, there's no sign of cancer in Benny's other abdominal organs.
And hold that like that, please.
Yep.
That side and that side.
Down here. Yep.
Eugene now checks the tumour on the ageing dog's spleen.
So look, that's your mass.
Oh,
Okay, so this was a good decision.
Yep, agreed.
Can you see it's already starting to rupture? Can you see the momentum adhering to it? So this was a time bomb.
Yeah, okay.
So
Look at this.
it's absolutely paper thin,
Yeah, it is.
and it could burst. That is a dangerous lesion, and it's already starting to leak.
It's a disaster.
Yeah, it's a disaster. This has to come out. That spleen, it was very diseased, and it could have ruptured at any time, and that could have been fatal. So I think it was an excellent decision on Dr. Cates to elect for surgery, and I think removing it is certainly going to extend the life of little Benny. Okay, you're going to have a go.
Yeah.
Eugene gets Kate to perform the final cut to remove Benny's spleen.
Done.
Done, there we go.
This could have burst within the next couple of days. So this is so lucky that this is out. This could have been a completely life-ending situation for him. So thankful.
You know, I think you're buying time for him now, which is great.
Yeah. It's beautiful.
Yeah.
Now it's over. I have felt like the weight of the world has just lifted off my shoulders. He's definitely not out of the woods, right? I get it. But honestly, I feel like this is the best day of my life. Hi, buddy. How are you? Are you good?
With just 3 weeks until Benny turns 15, Kate can now get back to organising his extravagant birthday party.
Such a tough dog. He may even reach his 16th birthday. You're a good boy.
Hello, handsome boy. How are you? You ready to go home?
At Scott's UK practice, Reggie is ready to go home after an operation to repair his injured leg, much to the relief of his anxious owner, Stacey.
I haven't been able to concentrate. I've been like that all day for that dog because I love him so much. Oh, God, I love that dog.
Hi, Stacey.
Oh, Midge! Oh, my God, look, you're shaved. Oh, Midge.
Oh, we're so happy to see you. His tail's going 100 to the dozen.
Midge.
It's always lovely to reunite a patient with a loving owner, and the relationship that Stacey has with Reggie is truly special. They've got a real bond, and to keep them apart was actually quite hard, but to bring them back together was beautiful.
I'll be
You
all
love
right.
this dog,
I'll
don't
be all
you?
right. Oh, I love this dog. I will be all right.
Well, he's done you proud. He's been a very, very good boy. And now all the hard work begins. So
Yeah.
a few weeks of strict rest and then about 12 weeks of recuperation, rehabilitation and recovery. All right, so a exercise which is really great for recovery from a cruciate ligament rupture and then repair is hydrotherapy, swimming. So is he a dog that likes getting in the water?
Yeah, he loves the water. If Scott thinks it's good for him to do hydrotherapy, then it's good for me. Even if I've got to run a bath, put him in the bath and he can paddle. So Reg is going to be going through the motions whether he likes it or not. Say thank you, Scott. Say thank you.
You're very welcome. All right.
Have a good evening.
Bye, see you
Thanks,
later.
Scott.
Bye, guys.
Bye.
Alison has received a call from a dog trainer worried about ongoing health issues with her own pet.
Hey, Dom. Good boy. Eddie has been part of our family for 5 years. We first noticed some health issues as a puppy. He seemed to be sick quite a lot. Chronic gut issues, diarrhea, generally feeling a bit lethargic, pretty similar symptoms to what he has now. I find it very upsetting because of the way he's feeling.
Alicia hopes Alison can work out what's causing the 5-year-old miniature dachshund's chronic problems.
Hello, Eddie.
Thanks for coming.
Thank you for having me.
Alison's arrival has lifted Eddie's spirits. Now she needs to find out why he isn't usually so energetic.
So what symptoms is Eddie displaying with those gut issues?
So diarrhea, obviously a sore tummy. He's had the blood in his poo once when we tried to give him a little bit of duck. We had to take him to emergency because he was that sick. Just had nothing but blood coming out.
Oh, wow. So any dog that's had long-term diarrhea or softer stools, mixing a lot of different proteins can sometimes cause an issue.
Okay.
If he ends up in hospital with that hemorrhagic diarrhea, it certainly is a sign that something very severe is going on. Is there any sort of key diets or foods that you know triggers him?
Definitely things like chicken or turkey or duck.
That really is a sign to me that he has severe allergies to certain proteins. All right, we might just do a quick physical exam on Eddie and just see what I can find.
Eddie's pretty special to us. He's our first dog and he's our everything. We just love him to bits.
So yes, Alicia, he's definitely quite tight and tense in his abdomen. Definitely signs that there's discomfort and possibly pain.
Good boy. So we really need to find a solution so we can help Eddie have a better quality of life.
Okay, Alicia, it certainly seems like Eddie does have some food sensitivities, and particularly considering his history and what you've told me, there's certain proteins he definitely reacts really badly with, in particular duck. So I'm going to recommend that we change his diet to a functional diet like the wild boar and pumpkin because it's a single protein. It's also a novel protein, which means that Eddie's unlikely to have had wild boar before. So we pop him on this diet trial for a couple of weeks, see how he tolerates it. We'll be able to see whether that's a food that will be great for him to continue for the rest of his life. So doing a diet trial is the best approach at this stage for Eddie. It's less invasive, we're not doing a lot of whole tests on him, and if he's tolerating it well, then essentially we'll diagnose the problem.
Okay, Eddie, let's try this wild boar and pumpkin. Shall we see if you'll eat it? Oh, you like it.
So this is a really good sign. He's really enjoying that, which is great.
Very nice and healthy. It's got pumpkin.
This will be great for his digestive health long term.
We're going to fix you in no time, buddy.
So hopefully after the trial period where his guts had a chance to settle down, we'll notice him wanting to be a little bit more active and hopefully just feeling a little bit happier as well.
Good job, Eddie. You love it. I'm so pleased. You want more?
In Sydney, Benny and his adoring owner Kate are proudly celebrating his 15th birthday, 3 weeks after he underwent life-saving surgery.
Well done. Party talks. Benny's holding up amazingly. I think everyone really worries about him and they're like, oh, he's 15, he's so old. I'm like, no, Benny's fine. Like, he loves a good party.
Fully recovered from his spleen removal operation, the resilient birthday boy is loving being the guest of honour.
Benny has had a blast. I think this was the best day of his entire life. It's beyond my wildest dreams to think that Benny would even live this long. Good boy, good boy. This is about both of us and about our journey together, and this love story is not over yet.
Unfortunately, 2 months later, Benny peacefully passed away with Kate by his side.
Good luck.
They're right there.
Good luck, mate.
See you later.
At the Australian Reptile Park, Tim is doing the unthinkable.
You right?
Going into the swampy lagoon, which is home to 40 deadly alligators. It's the only way to properly assess the damaged feeding ramp.
When I go under, the seconds feel like minutes. There's not a second I'm in the water that I'm not thinking gator.
Tim, don't move, mate. Stop moving. Oh, yep, got him.
I hear a noise, I jump. If my foot touches a rock, I jump. But I just focus on the job, keep the hands on the post, and have a look at its integrity. That one's good.
That one's good?
That one's good.
Cool.
Yep, all the way to the bottom. It is actually a little bit rusted.
Yep.
Not too bad, but I can pull a few corroded bits off.
No gators?
No gators.
Good.
Can I go under again?
Yeah, you go now, but hey, little girl, right at the boat. Oh!
Tim now needs to inspect a second post, but more gators are moving dangerously close.
That one's good.
You right?
Yeah, that one's okay.
The big male's coming, Tim. Come on, take a deep breath, Tim, he's coming.
I'm in the water, I hear someone say gator.
Yeah, stay there, stay where, got you, but they're coming, mate.
It's at that point, I'm pretty nervous, but I just trust in the team that they're gonna keep the gators away.
Those vibrations are really getting them going. Oh, 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 yep, oh, oh.
Well, watch one behind you there, Danny. That one's coming in hot, man.
I've got girls trying to jump at me.
Get me out of there.
Yeah, you're right. Good. Go. Yep, go.
When I got back out of the water, back in the boat, it was a great feeling.
Beautiful. They're coming.
Yeah, we'll hold this boat in. Don't move it. But then we're out, and there's a whole bunch of other commotion, and the gators are back at it again. Whoa. Out of here, please. No more.
This is ridiculous.
Whoa.
Whoa, Tim, watch out. Watch out.
Keep away, mate.
Watch out. Whoa! Someone's watching my back, yeah?
I think we're good on this side.
Get us out of here.
One thing left to do, and that's get the boat back to where we started. And we've got a whole swathe of gators any direction we turn.
Watch out.
Oh, sorry, mate. You right? Today was a success. Team safe, and we got the job done, and I'm happy that no one's going to fall off the end of that ramp into 40 hungry gators.
Just watch that, boy.
Yep. Thank you, fellas.
Do that in slow-mo.
4 weeks later, Eddie seems even happier to see Alison than on her first visit.
I get greeted by Eddie. He's full of energy, full of beans. He's jumping up and down. He's so excited to see me. Completely different dog to a few weeks ago when he was really unwell. Look how happy and comfortable he is.
Yeah, it's like he's a new dog. No more runny poos, tummy's feeling much better, and it's really good seeing how much happier he is in himself.
Good boy.
And in the UK, it's been 4 weeks since Jack Russell Cross Reggie underwent surgery on a ruptured cruciate ligament.
Hi, Stace. How are you? I'm good. How are you, you little fluff ball?
Today, Scott's making a home visit to see how owner Stacey is managing with his rehabilitation.
I'm very interested to see how this is going to go.
Normally I'm in my underwear.
You normally do this in your underwear?
Yeah.
Okay.
It's great to see he's putting his leg down whilst he's trying to get that food, you know. Whoops, see? It's fantastic. Look, it's maybe not exactly the way hydrotherapy is planned, where they're supposed to be swimming a lot, but this guy is moving backwards and forwards. He's getting a lot of attention, he's getting a lot of love at the same time, and he's using his legs. So, hey, I can't complain. Oh!